Um, wait, mute. Hello, hello.
Primero que inicie, bueno, presentamos nosotros.
Morning, everybody. We'd like to thank you for coming today and taking time off from your busy schedules again. My name is Christy Elias. I'm the head of the retail division. As you know, Laquis is a major part of health and wellness in the Trinidad, not only Trinidad and the Caribbean. We have locations in Barbados and Jamaica also. And we're very happy to have LOH Medical to assist us in this training session. So if you have any questions, we want this to be very interactive. Put up your hand, stand up in your seats, come and watch us do what we have to do, but let's make this fun.
Yes.
Thank you.
Once again, I want to thank you all for coming. We know, as Chrissy said, you have very busy schedules, so it's very good for us, and we're very happy to have you here. We're part of LOH Medical's team. We're a company that is based basically all over Latin America, and we basically help people with getting wheelchairs, rehab technology, and not only here in Trinidad, but in other countries of the Caribbean. And my name is Gismark Lopez. I'm the current sales representative for LOH Medical here in Trinidad. I currently live in Mexico City, and I'm a biomedical engineer. And I'm going to pass the mic to my teammates so that they can present themselves.
Hi everyone, thank you for being here. My name is Daniela Alvarez. I am the sales representative also for part of the Caribbean with Gismark. And I live currently in Dominican Republic, so thank you again and enjoy this presentation.
This is not for you, it's for our life. Yesterday I said for my fans. So my name is Giselle Espinosa. You can call me Giselle or Gis or however as you want. I live in Costa Rica, so my native language is Spanish. So I will try to explain you as possible as I can in English. So sorry again if I said some word like a runway, but I want to translate everything that I can. Okay, so thanks for being here. Today the training is more focused on PT, but I know here we have OT. Who of you are OT? Please raise your hand. OT, 1, 2, 3. Oh, 3. Okay. We have people here that came with us yesterday. So thanks. I hope you learn another things today to do. These are the topics. LOH Medical Portfolio Introduction. So we will show you the products that we representative. So the importance of positioning, I think it is a very important topic. Pediatric mobility equipment presentation, all the products that we have in pediatric area. Mobility equipment workshop. So later we want that you interactive with the products, making some adjustment. I think it is very important for you because sometimes you receive patients with another products, so you have to make some adjustments, right? Sometimes we don't know how to do it. So some key skills we hope to give you. Standing clinical benefits and equipment, and later at the end of the course we will see some clinical cases. So as a practice, okay, as a exam, practice. Okay, so now the presentation, it's an interactive practice with Daniela and Gismark. They will be participating with me. So as Christy said, you please feel free to raise your hand, ask questions in any time that you want. In the live, you can text any question and Christy communicate that with us. Okay, the importance of the physical therapies in assistive technology, because the assistive technology is more related with OT, right? But the PT is very immersed in that. Why? Because I am PT actually. So as a PT, we know all the body. We know the skills for rehabilitation of the people. We know the importance of the positioning. We know when we need some product to reach one goal in the rehabilitation of the patient. So it's very important that the PT is the guardian of a structural integrity. So your expertise ensures that the assistive device does not just move the patient, it has another goal. It's rehabilitation. It's prevent deformities, prevent issues in the future. So the difference, because there are differences, but I think the PT and OT have to work together. It's the ideal uh, in our work because we are a team. Remember, our main priority is the patient. We are based on the patient priorities. So it involves everybody. Involves PT, OT, the doctor, the nurse, the provider, right? We are all immersed in that. So we have a chart that you can take a photo if you want it, but it's in general the differences of the responsibilities by discipline. So in the physical therapies or PT, it's more focused on biomechanical alignment, and occupational therapies is more functional integration. OT is more focused on how that skills or those skills um, help the patient or the end user to be more independent or introduced to the daily lives, daily work. Okay, but PT is more focused on promote the strength, muscle strength, and tone. So how to move that part of the body, or how to reduce complications in the future. And OT, environmental modifications, so adapting home, adapting the people to the work, in the school, making more the work, or making the place more accessible, sorry. Then the PT, balance and stability, is more regarding rehabilitation, right? And OT, focusing on the user's role, on the patient's daily life. And the last one is injury prevention. PT is focused on, okay, I don't want complications later. I need to improve the muscle strength. I want to improve the movement. And the OT, okay, customization, specialize in sitting, for example, of skin integrity, comfort during the task that the patient we are doing, or the patient that will be doing. Okay, so now the next topic, it's more related to our brands, the brands that we represent. So Damiela and Gismark will be the presenters.
Okay, so let's talk a little bit about our portfolio. Okay, we are going to start with our own brand, One Law. One Law is born from the necessity of have a product like for affordable for all Latin America, okay, and also durable for Latin America. You know, well, I don't know if you know, but in Latin America the roads are not really stable, so we need a product to be like strong and affordable for the users. Then we have Sunrise Medical that most of you may know. Who knows who's Sunrise Medical? Okay, Sunrise Medical is one of the, I can say, the best brands ever. So, and we have a lot of products from Sunrise Medical here. Most of them are wheelchairs. Okay, then we have Rifton. Rifton is like a, Rifton have has a great story. I don't know if you can help me with that, like the story of.
They are a Christian
Yeah.
community. So they started at the Second World War.
So they emigrate to Europe and install to USA. So they are very specialized in rehabilitation. Have a lot of story. I invited you to
read,
go
yeah.
to their webpage. They are very focused on the quality, on the improve most pediatric and adult, but they are focused on pediatric and how to improve their lives regarding movement and more related to introduce that patients to the school. So to the regular
Daily life.
school process.
Okay, so then we have Circle Specialty and Firefly. These are especially in pediatric products. I don't know if we have, yes, that one is from Circle Specialty, the stroller, the red one. And the single
orange one.
Yeah. Okay, then we have the ES Access. These are like I forget the name, like
Easy access is
ramps, exactly. Then we have the Aqua Creek. These are all the products for the beaches. Okay, wheelchairs for the beach with big wheels and or pools that we use in the hotels or everything. Then we have the Pride. We have Pride here also. These are the scooters, really good scooters. Then we have the Rojo Cushion. We don't have any Rojo Cushion here.
No.
No. Okay. Then we have a Special Tomato. Also is for pediatrics, right? Special Tomato. Can you help me with the last two? Those últimos.
Joints, it's more beds and lifts to patients. So moving the patient from bed to the sofa, for example. So it's more lift and beds and mattresses too, special mattresses. And for basics, it's more daily use, like
DME.
DME. Yeah, DME. Yeah. It's walkers, rollators, crutches, canes.
Okay, this all the portfolio that we manage, and let's go to the other one. Okay, these are the products. Let's just basing Sunrise Medical products. Okay, we have the Quickie. Quickie are for adults. Okay, wheelchairs. Then we have the CP that is for pediatric wheelchairs. Then we have RJ, bueno, RGK. Okay, RGK are like ultra light wheelchairs, like more for sports people to do sports, like really good products.
Products very personalized literature. So, for example, if you see that wheelchair personalized, yeah, but RGK is very personal. Why?
Very precise.
Here we take around 10 measurements, and in RGK around 25. Because the wheelchair doesn't have adjustment. It's for you. Second with that measure. Doesn't work for anyone. That's free. Okay? So we are in that way, but it is more expensive, of course. So get one, but those
Yeah. Okay, then we have the Magic Mobility that is for motorizadas. How do you say it? Power. Okay, power wheelchairs. Then we have the J. We have like J for backrest and cushions or headrest and all of this. Then we have the Build for Me. Build for Me is like when you need a product like really specified, for example, like for obese people, and you need something extra that you don't have in the normal configuration. So we go to Build for Me. And then we have the Laquis. Laquis is for standing or more like physiotherapists, like that. Products. Exactly.
Products like standing, sitting, walkers, but more.
Okay, I don't know if you want to say something else about this. Okay, so let's go to the other one. Okay, here we have like all the products in Sunrise Medical. Well, most of them. Okay. Um, first of First one is the quickie. Okay, this is for the adults products, manual wheelchairs. Okay, we have the folding ultra lightweight wheelchairs. Let me show if we have. No, we don't have. Okay, then we have the rigid. Okay, I can maybe mention some of them. In the rigid, we have like the Nitrum. I don't know if you know about that chair. Have you heard? Yes? Okay, good. Okay, tilting space wheelchair. This is the Wiki Iris, for example. Then we have the heavy duty manual that was, the name was M6. I know Besker probably know about the M6. And then all the options and accessories. And then we go with the CP, that is pediatric manual wheelchairs. Do we have no?
Yeah, we have here one. Escape. This is one.
It's a little naked. Okay, this is one of the pediatric wheelchairs. This one doesn't have like the backrest now or the cushion, but well, this is the wheelchair. Exactly. And normally we have the backrest, the cushion, and all the items. Okay, also we have the children rigid, the children tilting states, and early intervention strollers that we have the, I forget the name. Voyage. Okay. And then we have all the RJK products. Okay, that is made to measure wheelchairs. Okay, super specified for each user. Okay, and then the bill for me, that as I mentioned, the bill for me is if we need something extra that Sunrise needs to help us.
So here you can see one of our brands is Sunrise Medical, right? But here we have manual wheelchairs, power wheelchairs. Power assist is very intended because power assist, these are products that improve or protect articulations. For example, very active patient or very active users every day using the chair, the wheelchair, suffers pain, limitations, right? So Sunrise designed some products that they are powered to assist that propulsion, doing more efficient the propulsion. So later, I think in another invitation, we can share with you some accessories. So they are very interested. I think they are very useful for the business and a good solution for them.
Like the one with the breathing to move the wheelchair,
Yeah.
like what we did last time.
Yeah,
You can
it's
explain
true.
that to them,
Yeah.
see if they have any.
Yeah, but we have four different products there.
Oh,
So one for the caregiver and three for the end user. But they are very interesting. So then we have sitting and positioning. So regarding cushions, backwards, and many other positioning components and back moving. So that is the idea of this, is to let you know in manual wheelchairs we have adult, pediatric, very specialized, and making it special for any need. And
So I remember when I started working at Low Medical that I thought rehabilitation products were just like the wheelchairs that you saw in the hospitals, right? And in my first month working there, I noticed that, oh my God, this is totally crazy. Like I never imagined that a wheelchair will have so many types of different functionalities, so many types of accessories that you have to consider when it comes to helping the patient in their specific needs, right? Here in Trinidad, I wanted to ask a question for you guys. Do you see more pediatric or adult patients? Both, I think a combination of both. Yeah, so I never thought that, for example, in pediatrics, they were so important to take into consideration what the limitations of the user would be, what type of how do you say posicionamiento? What type of positioning accessories you have to consider. So it's basically like an entire world that opened up to me, and it was totally crazy, right? Seeing wheelchairs and rehabilitation products are very important to take in consideration. So in our catalog of products, we can start talking a little bit about the adult line. In this case, it will be the Quickie line of products in Sunrise Medical. I guess you guys have seen most of the Sunrise products here in Trinidad. I think Laquis is a very big purchaser of Sunrise products, right? Yeah. So yesterday we had a session talking a bit more about the technicality of rigid and folding wheelchairs. You guys know what those type of wheelchairs are? The difference between a rigid and a folding wheelchair? Yes.
Yesterday we saw it.
Yeah, for example, here we have an example of a wheelchair and a folding one.
Yes, so rigid wheelchairs, you can consider them to be more suitable for active users that have upper mobility, they can propose themselves, while folding wheelchairs, they are considered to be more versatile and when it comes to transportability, since they can fold down. If you see here in the frame, I'll show it also on the camera, you can see that there's a shape of an X right here, correct? This X allows the chair to fold. I don't know if you can help me by showing an example. So it can fold and you can transport it. This will be considered to be a folding wheelchair, while a rigid wheelchair, if you see on the frame, it has a bar that does not allow it to fold. However, yeah, as you can see for our friends in the live stream, there's a bar in the middle that prevents it to fold. But you can consider what will be the difference between a rigid and a folding. Well, each of them have their own benefits. In this case, this wheelchair will be very lightweight. I could practically, oops, sorry, hold it with one hand, right? I could just pick it up like this. But if I try to do that with a folding wheelchair, it will be way harder because it has more parts. It's way heavier, but each of them has their own pros and cons. You want me to try to do it, right? It's gonna be super heavy. Yeah, it's heavier, way heavier.
It's like because the design of the model is new. But in general, rigid chair rigid chairs are lighter than folding chairs because it has more material and more moving parts. You are proposing the chair. The idea is to focus the proportion on translate, right? But if you have a lot of moving parts, that force comes to another part. So not focus on translation, focus on how to move all moving parts. So in cases when we have very active patients, we recommend more a rigid chair than a fold because of that. But if the, for example, child is active but not too much, and it is more using by the caregiver, pushing the patient, so we can consider pollution. It's very
Yeah, so I'm sorry.
Or if you have a patient, a pediatric patient that needs a lot of supports, it's more that you're interested more than
Yeah, so each of them will have their pros and cons. It depends a lot on what the user or the caretaker and the family want for the user and their needs. Also, another line that's very important in some countries like the United States will be the heavy duty line. I don't know here in Trinidad if you see a lot of bariatric patients, obese patients. Is this very common here or not? To say yes?
In Bonaire, yeah. So I have one of my clients here from Bonaire, and I know in Bonaire they have a lot of heavy duty, and you use it a lot.
Yeah, so these heavy duty wheelchairs, of course, are going to have to withstand a greater weight capacity. Usually the frames are going to be larger, they're going to accommodate larger cushions, and they can be either rigid or foldable. So these are more specific, comes in a case by case scenario. For example, in some countries are going to be way more common to see these types of wheelchairs out in the open. In other countries, not. It depends more on what the country has on their needs, right?
and has and imports
Yes. When it comes to pediatric products that we offer in our catalog, we also have rigid and folding technologies when it comes to the wheelchair. For example, here you can see a wheelchair that does have a folding frame. This will be an early intervention, not an early intervention product, but more of a pediatric product. This will be a folding wheelchair, for example. Also, when it comes to pediatrics, you can see this type of product that is more of like a stroller for carrying the babies, and you can also add positioning attachments that will make the user be more comfortable over time. Usually, you can add a table to it. It comes with a little sunroof. So pediatrics sometimes, well, I consider pediatric products to be, you could say, more focused on the comfortability of the pediatric users. Also, while taking normal products like a stroller that you see for a baby and adding the type of positioning needs that these users are going to have. Also, as Daniela was mentioning at the start, other types of pediatric products that you can see on our line will be harnesses that can be hooked into the cars. That is something very important. Car booster seats, etc. So pediatric products usually are way more varied than adult products, but they're also super important when it comes to taking into consideration our users. Then we have a little bit of a more specialized line when it comes to, for example, more active users, let's say athletes that need wheelchairs for their sports uses. For example, uh, have you guys seen the Paralympics? I guess you guys have seen it, right? Most of the wheelchairs are going to be ultra lightweight. That's very important for them to have because they need to propel themselves easily and faster, especially in competitions. So this will be an example of a more active wheelchair. As you saw before, I was able to carry it with one hand. It's super lightweight. And you can see it when it comes to more active users that they're going to be playing sports. They're going to be moving around by themselves a lot. So it's very important, for example, the frame to be ultra lightweight, as I was saying. It can be easily transportable and be comfortable for these users that do have that kind of maneuverability by themselves and autonomy by themselves. Also, well, sports wheelchairs, usually they can be a little bit more expensive because, they're going to be more specific. They're going to have a carbon fiber frame that's going to be the, well, the light is ultra light. Yeah, it's going to be a little bit more expensive, but it's also important, well, to consider that these athletes, they usually are going to have more specific needs that perhaps a normal wheelchair, like a rigid or a folding wheelchair, are not going to be suitable for them because they do need like that extra power, that extra functionality. And when it comes to power wheelchairs or scooters and this type of electronic, or mechanical lines, they're also very important to consider when a user has basically little or no mobility at all. Sometimes it's important to consider electronic and motorized wheelchairs to these users because they basically can move themselves by their own. Sometimes these users do not have access to caregivers and they do want to have that autonomy, so it's very important to consider these types of wheelchairs for these types of users. Some of them can have very huge tires that will allow them to move through different terrains. I guess here in Trinidad, the sidewalks are usually not that stable, right? There are a lot of potholes. It can be very difficult if you have a wheelchair to propel yourself to. Well, an electronic and I would say a motorized wheelchair is going to be a very suitable option for these types of environments where you do need like stronger tires. So you need that type of mobility that a motorized wheelchair is going to give to you. Also, sometimes the controls can be ultra specific, and most of the motorized wheelchairs are going to have their own joysticks. Well, now there are some wheelchairs that can be controlled by your voice, so you can just talk to the wheelchair basically like it's your own assistant. You say wheelchair forward, and it's going to push yourself forward. So the technology is advancing a lot here in the motorized wheelchair area, and it's very interesting to see how much technology has come forward and allowed people to have this type of autonomy with these types of wheelchairs. Also, scooters are very important. You see basically scooters, I guess, here in the supermarket. I don't know if it's common here in Trinidad. Yeah, in the hardware stores that you usually offer scooters for people that want this type of mobility in stores. They are very common. Also here in the showroom, you have scooters too. Hopefully we can go see them later down today. So yeah, it's not only motorized wheelchairs that are here being promoted, also scooters and standing products that have this motor functionality are very important to consider. So when it comes to pediatric manual wheelchairs, you can consider some of the products to go in a ladder. Like you start with the simplest product and then you start going up, having more functionalities. For example, the scooters, you can see and it looks basically like a toy, right? Something that children will really like to be on because it feels fun, it feels comfortable, but it's not going to have all of the positional needs that the user may have. So then you start going up the ladder. Yeah, it's basically like this.
You can use it to teach us how
Sí,
to
la-
walk, and then use it as a wheelchair. So it's being one raw, sitting, moving the legs, and wheelchair. What age would be that? Yeah, it is firefly. What age? Age.
Like remote, like 0 to 2, I think.
Age. I think I think one, one, two, four.
But it's like a for measurements as well. It's
Depends
not
on
much.
on the size.
Yeah.
Depends on that.
Yeah, so you do have like these tiny little wheelchairs that are gonna be for ages 0 to 4, basically, or 5. Yeah, it depends a lot on the size of the user. And then you start going up the ladder and you start seeing, well, more common type of wheelchairs like the Seago. Here we have a Seago R. This is also a pediatric wheelchair. As you can see, it's very small, it's very comfortable, it's a folding frame, and it does have a reclining functionality. Yeah. Then you can have more specific products under the Zippy line, like the GS wheelchair or the Escape. We don't have an Escape here, right? Oh, there you go. Yeah, this is the old other type of folding wheelchair. And as you can see, in comparison, when you're going down the ladder, this is going to be a simpler, way more economic product compared to this. This one has a nylon backrest. This one currently does not have a backrest, but this is because you have to take in consideration what the user is going to need. You're going to take their measurements. You're going to see what type of positioning, what type of backrest could you recommend. So the frame basically does not come with a backrest, so that you can add one later down the line or during the purchasing process, and make sure that's going to be way more specific for the user. So this ladder is very important because when you're dealing with patients, sometimes they're going to need something very simple, right? Or sometimes they're going to need something that is very advanced for them. So it's important to consider that a catalog of products needs to be varied. You need to make sure that every type of need for every type of user is going to be covered.
So you can see some differences. Here is more standard. It's a standard. Why? Because I don't have the possibility to grow that. It's a measurement and that's it. It's a size and that's it. Okay, but here you can have the possibility that the patient grows with that. Grows with that. So how? If you can see here the cross, you can see holes right here. So you can adapt the width and then you can adapt the depth too. So you have more adjustability here than here. Okay, this is more standard. It's for patient that doesn't need any special. So, for example, hospitals or clinics that you can find, I don't know, wheelchairs, standard wheelchairs for kids, and it is not correct. We have standard wheelchairs for children. Okay. So another difference between CPGS that you saw it is this. The Escape has the particular characteristic that if you unfold the chair or unfold the chair, here, please hear that. It blocks. So when I block the cross, I convert that chair in a rigid chair. So the idea is it is focused on patients that needs or will be more benefit with a rigid chair, but the mom said, no, I want a folding chair because it's easier to me. But the kid needs something more rigid because it is very active. So that is a good solution. It is new because of that. You can reduce or you can collapse or clock that cross and convert the chair in a rigid chair. See it. Normally, if you take this and you move, maybe you can move the cross, right? Here. It's more unstable, right? But if you try to move this cross, it's very fixed. Fixed completely. So it converts that system, convert the folding chair in a rigid.
Yeah, so as you go advancing up the ladder, as you can see, the functionalities of the wheelchairs are going to be changing. They're going to be more interchangeable and more advanced. And another product that sadly we don't have here, but hopefully in the future we could, will be the Sippy Sun, which will be a rigid wheelchair that's more considered to be for active pediatric users. So as you can see, the catalog is very varied. You can have basically any type of product for any type of need that the user is going to have. And another line that is very important will be the tilt in space wheelchairs. Do you guys know what tilt in space means? Yes, perfect. So tilt in space wheelchairs could be considered to be important for neurological patients, patients that do not have very, ¿cómo se diría? Como acceso a movilidad. Yeah, neurological patients that are not going to have a lot of mobility. They're going to need a caretaker to yeah, they're gonna need more support.
The patient doesn't have control, trunk control or head control. They are very passive.
Yeah, so these tilt in space wheelchairs, they have this very important functionality that they can do both a tilt on its backrest. I'm sorry, a recline on its backrest and also a tilt on its axis. I'll give you a little demonstration here. After that, you guys are going to be able to play with the wheelchairs. So, yeah. For example, if you see here, it's going to maintain its axis, but it's going to be able to tilt. What is the importance of this? Well, if a patient is going to be on the same position for a long amount of time, that's going to lead to pressure. Exactly. So a very important way to relieve the pressure is to change the angle that the patient is sitting on, so that, for example, the pressure is relieved not only from the buttocks area. You start moving the patient and you move those pressure spots to the back. That way you prevent in the long term for the user to develop ulcers, which can lead to death. So it's very important for this type of patients that do not have a lot of mobility, that they cannot, for example, also say to their caretakers that, oh, I'm feeling uncomfortable, have easy access to this type of mobility that I can even do with one hand, right? Oh, I think I got stuck here. Uh-huh, see.
You need
Both hands, yeah.
So that is the difference. Line just move the backward, and it involves the pelvis. If you move or if you climb, the pelvis moves. So when you have patients that have a lot of spasticity and high tone, if you do this, if you move the pelvis, boom, right? The patient is so those cases is perfect. Pelvis, high tone. So, but if you need to take that one under control, this as just for a tilt. Tilt is better because we control, we stabilize the pelvis and control that time. So in these models, you have both, but you can choose just tilt, just recline, or both. Okay, and remember, if you ask for recline, you must ask for elevating legs because it's biomechanical, right? In this case, I want to give you or putting you in a proof. Please, sitting all of you very straight as a JLo, very sexy, in a neutral pelvis position. Sorry, fans. Oh my god. Oh my god. Yeah. Okay, so everybody's in a neutral position of the pelvis. Yeah, you did it yesterday, so you are prepared. You too. So there, please elevate your legs, both, both legs. Don't crash. Don't crash you. Very high, very high. So it hurt. Is it hurt? Yes. So in that position, please do a posterior pelvic. Yeah, like this. Yeesh. It reduces the pain. Is reducing, right? So thanks. Why sometimes we consider a standard wheelchair or a wheelchair without reclining, it's a good option putting elevating leg rest. Why? You suffer. It hurts. So please be careful when you see a patient with a wheelchair just with elevating leg rest. Maybe you are doing damage and not any benefit. It's clear? Is it clear? So always we have to be emphatic. How can I say that? Emphatic. Okay. Empathetic. Uh, because you have to be in the place of that patient doing the same, because never we understand 100% the situation of the patient, never, because we are not on that position. So we will try to understand, but it's different, right? So one time ago, I received a feedback from a patient saying, "You don't understand me. Don't be lying me. You don't understand." And I said, "It is right. I couldn't understand you. I cannot understand you. Sorry, I cannot, because I am not in your position. But I'll try to understand you, and I'll try to help you." So remember, be empathetic. Mhm. Empathic. Empathetic. Oh, I am learning a lot of words here.
So yeah, these type of products, you could consider them to be over at the top of the line when it comes to pediatric wheelchairs. But Tilt in Space is not going to be limited only on wheelchairs. You can see this type of technology also in strollers. Um, I wish we would have a Stripe wheelchair here. Sadly, Stripe stroller here. Sadly, we don't. But it would have been great to see that type of functionality in a stroller, right? Also, strollers are very important and can be, I'm sorry, I'm covering the screen, can be very varied when it comes to their functionality. And as I mentioned before, other type of products that are very important to be considered for pediatric patients are car booster seats. I've just been here in Trinidad for a day and a half, but I noticed that there are a lot of cars. I think everyone has a car here or knows someone who has a car, right? So having these type of products for cars and vehicles is also very important because it ensures the safety of the user in a moving vehicle. And also, well, strollers can be very comfortable for children. Having a harness is also very important, not only on a wheelchair for, like, for example, for neurological patients, but well, pediatric patients in general. Also, there are pediatric powered wheelchairs. They are very similar to the adult type of powered wheelchairs, but of course, they're more suitable for pediatric patients. They usually have the same functionality that you will see on an adult powered wheelchair. They can have a joystick, they can have voice controls, but well, they also are going to be suitable for children and they can grow with them. Most of these wheelchairs are going to be kind of expensive, so you want to make sure that it's going to last a lot long time. And like as Giselle mentioned on the other folding wheelchair, that it can expand in size. Most of these powered wheelchairs are also going to have that functionality because you want the wheelchair to last as long as possible when it comes to children, that is going to grow over time. And besides from wheelchairs, as I mentioned before, there are also rehabilitation products that are very important, especially for OTs and PTs that you want to train some type of muscle in specific for the user. This will be what we call a pacer gait trainer. In this type of products, the user is going to be able to train their legs. They can do walking with this because it's going to assist them. And rehabilitation is super, super important because you are giving this type of exercise to users. They're going to feel very comfortable having this type of exercises because if you can show the supports that some of these products have, they're going to have a little seat so that they can stay here. It's going to have a belt. It's going to have an armrest. So the user is going to be very comfortable. And with the help of a rehabilitation program, they can start training their legs. And it's very, very important and very beautiful to see in use. Other types of rehabilitation products can be a stander that's basically going to hold a patient in place. They can the stander usually can fold all the way to 90 degrees. So you load the user over here, and then the stander basically puts them in a standing up position. Yeah, and this is very important to make sure there is ¿cómo se dice? Vasculación. No, o sea, o si puedo explicar, puedo explicar eso.
Sorry, we need to understand us. So it's not common to us talking, speaking in English. So be patient, please. So the idea is when you, we will see it later, the importance of standing because you stimulate the circulation, yeah, and the bones. Um, Estimulación de crecimiento óseo. Óseo. We stimulate the bones. So eating the bones. It's that one. Okay. So we have a lot of benefits of the standing, but we will see it later.
Yeah, rehabilitation products can also be something as simple as a table that can rise in height. I don't know here in schools if they are very accessible to people that have some type of disability or condition. No. So it's very important to start seeing the needs that, for example, users are going to have in their daily life. Something as simple as a table can be considered as a rehabilitation product. So it's very important to take in consideration that sometimes a wheelchair is not going to be enough. You're going to have to see what other products a user may need in their daily life for having this type of rehabilitation exercises. Giselle?
Okay. Why positioning is very important to you as OT and PT? Because we are focused on physiological health and therapy, of course. We are very interested in reduce the pressure injury. It is basic. Why? Because if you have a pressure sore, it attend with your life, right? So in the priorities that we have to check, one of them is the sensitive. If the patient or the end user has sensitive or not. Why? Because it is crucial to determine which product or which positional system we will choose. Okay. The other thing is skeletal alignment. Of course, the posture is very important. Prevent deformities. So it is very important to all of us. Vital organ function. Remember, the organs are in the correct position. They are designed in one position. If you modify the position of the organs, you will have problems. Maybe sometimes big problems or small, but you can have it. So, of course, reduce the pain. If you have pain, you have a patient that just want to be on the bed. What is the worst place to be? Bed. The second one, sofa. And third, mom arms, right? the poor places. So that it is important. Because of that, we design, I design. The experts designs products, for example, special cushions. I will show you what is the difference between bases of the positional system. Let me put it here. So we have here 1 and 2 cushion. I have another, no. Okay. Different cushions, okay? We have standard, less standard, so in moderate and high positioning. Ayúdame a quitar las fundas. Ay, este no, el chiquitito, el chiquitito. Where is the, está allá. No, eso es una mochila. ¿Dónde está el GS de nosotros, el que trajimos? Uy, tiene que traérmelo hasta allá. Sí. It is very old, so we have another one. But I want to show you the difference on bases. So here we have standard base. We have different kind of foams. Yeah, and we have another. No, pero hay otro. Estaba ayer. Christy, where is the GS? The cushion GS? The small one. Creo que debe estar allá. En alguna silla. Give me a second. That cushion has like 10 years. Yeah, really, it's very old. But I bring one new. So we have 2 bases or 2 kind of foams. Is the same density but different firm. Okay, so we have this foam with this foam is the same density because the density means component inside components, okay, composition of the foam. So it determines the quality of the foam, but it's the same. But we have we have different firm. Firmeza is firm, right? Firm. Different firm. So some cases we just need that firm, yeah. But in another cases, when we need more positioning, we need another kind of firm with like this. So if you can see here, we have different firm. So touch it. Touch. It's different. So one is more firm than other. And sometimes we recommend that one for everybody, right? We recommend, cushion, anatomical, contour cushion. Oh, good, it's good. But it's not for everybody. If you have some conditions in your pelvis, you need more support. You need to stabilize the pelvis. Stabilize the pelvis. What that word is? So stabilize the pelvis. You have to control that movement. So can you control with a soft foam? No. And imagine you have an end user that feels, but he cannot communicate anything. Yeah. So when you sit on that cushion, if you sit in a wrong position, you will feel the contour, right? And you said, like, something, there is something there. Yeah, you feel. But if the patient doesn't feel, you put pressure in another point and put the skin in troubles, yeah, in risk. But if you have a patient that feels but cannot communicate, okay, sit there uncomfortable and say nothing, right? So many cases we do that. So it's very important that difference when I have to choose one vase or another, okay? Here in this case, for example, when I have this one that it is soft, and it is soft, and I said good contour, it's okay. I feel, I see, I have the cognitive the cognitive situation good. I am good. Yeah, I have all my capacity. So it's good for me because I feel, or I can see me in a espejo, in a mirror, and I say, oh, I am in a correct position. Okay, I have to correct me. Yeah, but if I don't have it, please don't choose that, because you don't have the way to correct a bad position. But if you have this and you put a patient in a wrong position, see me. It is too big to me. So if you put it there, you can see it. I can see me, right? So you can correct it. But if you have this, you cannot. So if I have some movements in my pelvis, I have here more security, more stabilized, right? So I cannot move as easily as I can. So I can control the movement. I can control the tone, the high tone. So in patients that you see in a bad position, please guide them to use another things. It has sense, right? If you use this, it's not for positioning. It collapses. It is very soft. If you have positioning, you need more firm here. So for example, if you have a patient that has that condition, right? And you said, oh, he needs an abductor. Put it a pillow there. It's very common because I don't have it. But if you have a good cushion, a good sitting positioning system, and you use, for example, it's a little bit, it's not hard, it's soft. But if you put something like this, that it is hard to, it's very firm, and put it here, just align the femur. If you have, or if you need more, el otro soporte grande que tiene el que está viejito. Ah, se lo llevo. Ah, pero el separador. So if you need more, you need a higher support here, we have different sizes or different designs. So you can use it a different part. Gizmar is coming with that. So for example, if you have this condition, and it is bad position, but always has that pattern, you need to correct it, right? So you can use, thank you, you can use supports here. So align the femur. And then if you need more support here, you can have another positioners. So then you can put the cushion. ¿Dónde está el gel? El gel de este? Ah, okay. And then if you need, then you can put the comfort. Yeah, the skin protection is the liquid gel or the gel, specialized gel. If you can touch this, it's not liquid. It's like aquoso. How can I say aquoso? It's like jelly. Yeah, it's like jelly. So when you put your ischial tuberosity here, you have this, you have this, and liquid is there, the gel is there. So if you have, see, if this would be liquid, actually, if I put it there here, I touch the floor of the seat, right? And it's good that? No, because I can produce pressure there. So we need that condition, that kind of help, because I need to involve the bones, the prominences. I have to involve to prevent skin damage. So touch it, see it, doesn't move, doesn't move. It's a good gel. Pass, please. So that is the difference, and why we choose one or not.
Prevent bed sores.
Yeah, of course. Depends on the quantity of the gel, but because we can adapt it, we can choose how many gel we can put it there. So it depends on the patient needs. So the patient needs more because I have a high risk of pressure sore, I put more. Yeah. Okay. So all of these points are important because we are very interested in promote mobility and independence, but with careful, yeah, with doing the environment more secure for the patient. So we need to stabilize the pelvis, the trunk, the head, because always are related. If the base, our base of positioning is the pelvis, remember, if the pelvis is good, in a good positioning, maybe it's more easy for me work on the trunk. If I control the trunk, it's more easy for me, it's easier for me working on head, right? Sometimes, I don't know if you have patient that has that condition, but sometimes we have patients that doing this. Ay. Necesito quitar esto.
Para quitar el headrest.
The patient doing this. They are here, right? And doing this. Right? You have it. It's common to see it, and the mom, oh, and again, and they are very happy doing that. But if you control how to avoid that, sometimes we said, Anna, put wings here, put wings. So here he cannot jump it, right? But it's like a horses in a competition. See just in front, not see anybody more, right? It's not the best option. Sometimes we need it, but it's not the best option. Why? What happened there? When we have that condition, is because the patient has the ability or the possibility to move the trunk. Because if you move just the head, impossible to do it. It's just Matrix, the movie. Why? Please try it. Stabilize your shoulders and then try to move your head in another angle. It's very difficult to do this. Imagine just without moving the shoulders. It's like I cannot. So I need to move my shoulder to do this. So the key on those patients is stabilize the shoulder, control the shoulders, and then you avoid that. So we have many types of headrest with different purposes. We have one that has a like arms here. In those cases that as I mentioned you, that has arms, and then when the patient wants to turn or to move the shoulder, he cannot. So it's more easy have control of that head. So in regarding backrest, if you have a backrest or a patient with that, with this condition, that it is in posterior tilt, in pelvic posterior tilt, and I said, oh, I want to put it more in 90 degrees, right? Because I have, maybe the patient has, maybe fixed here, some fixed structure, some structure fixed here, right? So it is a structure. So what is the option? Different. I have this thinking, if I tilt the patient, if I recline the backrest and put the backrest more close to the lumbar section, maybe I will need less feel to put and align and do a good print on the back. Yeah. Another option or another case, if you have anterior tilt, I'm not J-Lo, but if you have this condition and you put the backrest here, pueden pasarme respaldo, por favor? And you put the backrest here. Okay. Ajá. Para abajo. Ajá. Se me caigo. Thank you. Okay. You have this condition, okay? And you put the backrest here. When the patient touching, if I want the patient touch the back to the backrest, I need to do this. Or it means more hyperlordosis. It's not correct. I stimulate that. So I need to do this one. Put it up, put the support where I need, and then rest the backrest, your back on the backrest there, right? It's better. Less feel, maybe. I need less feel. And I leave here or this area free. Not pressure. Remember, one of our points with more risk of a pressure sore is the sacrum. It's because of this. We never recommend start the backrest from here because push the pelvis forward. So you maybe experience that. Okay? We have, when we stabilize the trunk, the pelvis, the trunk, and the femurs or the legs, we stimulate more mobility on the other parts of the body, arms, legs, head, so they can be more. They can have more mobility. Okay, more independence with control. Of course, we stimulate propulsion efficiency. Then always and obviously the psychosocial well-being and quality of life. So we can increase the tolerance on sitting. Yeah, we can improve self-image, so they feel comfortable, they confident, they feel better, and it is very important. Remember, just one thing, a simple thing: choose the color of the product. It's important. When you buy a blouse or a shoes, you said, I want black or beige or khaki, but you can choose. It's good or not, of course. So they have that possibility too. And obviously, and no less important, the social integration. Most of the patients are inside of homes. Doesn't work. They cannot, that social activity, that social interaction, and they promote it. Sometimes one wheelchair promote or increase the depression of the patient. For example, if you ask, what do you need? Yesterday, I have a patient and I need, what is your desire in a wheelchair? What is your desire? And she said, okay, you are asking me by my desire, right? So shiny. Yeah, I want a power, something like I can move. Of course, she has the ability to do it. But she was afraid. So is it possible? Why? Because in our mind, power wheelchair is expensive, right? Oh, it's expensive. So, but why not to recommend it if it is good, if it is what you need? So always remember, ask the patient what is his or her desire. And that power share makes me maybe more happy, more social active on the society, right?
I have a question. I know this is a lot of the issues that their patients face. They may need a power chair, but they may not know how to move it or transport it from A to B, and or they can't afford it because insurance doesn't pay for these items. So what do they do in those situations?
Yeah, we have a lot of types of models of wheelchairs. We have wheelchairs that we can collapse or we can fold to put it in a car. So we have a different kind of models, but depends on the patient, depends on the diagnostic, and depends on the daily life of the patient, so kind of life that they have. So if you have those cases, remember to justify the reason why we are recommending that product. If the patient, for example, has the diagnosis of dystrophy, muscle dystrophy, what? Why not? So how can I justify that? Easily. It's a patient who needs to conserve that energy, because if we don't do that, we kill them muscle fibers and reduce the life of the patient. So remember, it's not a luxury. Luxury?
Luxury. Yeah.
It's not a luxury. It's a need. But you have the knowledge. You are the professionals. You have to guide that patient why it is important, why you need that, how to do it. So we can do a letter, I don't know, to insurance, but justify good with good basis based on the life of the patient, and you will never receive a renegade, rejected.
Is there any maintenance required for the electric?
Yes. Yeah.
Repeat the question.
Well, she questioned us if the power wheelchair needs some maintenance, right? Yes, needs maintenance. Needs, for example, all wheelchairs needs maintenance, of course. But power wheelchairs, the careful that you have to have is care the batteries, the charger, and charge every day and use every day. Because some people think, oh, I couldn't, or I reduce the use of the power chair because I need to conserve it. No, 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 no. You have to use it because it's like a car. If you don't use the car, the battery and the motors die. So the maintenance is every year, once a year, and it's more regarding with the poles. Motors has 2 or 4 poles that you have to check. The poles is the carbons that the motors needs to work, and care the casters because they are dirty and with hairs and every stuff there. And I want to.
In general, since powered wheelchairs are going to have motors, they're going to have pistons, they're going to have, let's say, tenfold the amount of moving parts that a regular wheelchair have, the maintenance needs to be more complex. When it comes to batteries, usually a battery can last from 5 to 10 years. It's a big gap because batteries can degrade over time because of the weather, because of the use. But usually, these lithium packs of batteries that are very big and very heavy that are used in these powered wheelchairs, they can last between 5 to 10 years. It depends a lot on the use that the wheelchair has. It is a very common problem in humid places like here in Trinidad that the batteries start to expand over time. So it's also very important to see the integrity of the battery every month, every 2 months, to see if the batteries are not expanding, if they're doing all right. And as Giselle said, make sure to charge every night after each use that the wheelchair has over a day. try to not keep it plugged in a lot of hours, because also batteries can expand because they're being overcharged. And in general, well, the gears and the pistons and the motors, they need to be greased up using either industrial level grease or other type of lubricant. So yes, powered wheelchairs do need a little bit more maintenance than normal wheelchairs in general because of this, and the batteries are very important to take care of.
Never let it die. Batteries die.
Yeah, make sure, like your phone, you never want to let your phone go down to 0%, right? If you want to ask a question for the
I have a question. How can you optimize the battery?
to optimize the battery, the best way to do it is, as Chrissy said, never let it die to 0%. Always make sure the battery has some type of charge. Also, make sure that you do not keep it in very hot places. Make sure it's, for example, in a normal temperature room between 25 to 35 degrees Celsius. Do not overcharge it. So it's basically both sides of the spectrum, right? Do not let it die, but do not keep it plugged in all the time. Those are like the basic battery maintenance needs that you have.
Does the climate play a role on the durability of the machine?
Yes, in general, the climate, for example, in Trinidad, that is very humid, it does affect wheelchair frames in general, because as you know, we're right next to the sea. The sea is very salty, and the wind, even though you may not feel it physically, but that wind is carrying little particles of salt that are going to be attaching themselves to the frames and to the moving parts of the wheelchair. So it's very important to make sure to clean a wheelchair or any type of rehabilitation equipment in general at least once a month. Make sure you grab a damp towel, you clean a wheelchair. Moving parts are also very important to be greased by lubricant, as I was saying. So yes, here in Trinidad, the weather is very, very influencing when it comes to the longevity of products. Any other questions?
As it pertains to transportability for airlines that do not permit lithium batteries, what are the alternatives, or are they permitted when it's for a wheelchair?
Yeah, when it comes to rehabilitation equipment and wheelchairs in general that are powered and have lithium ion batteries, when you have the product itself, that can be considered its own justification for an airline. But sometimes other airlines are kind of stricter. They may ask for a doctor note that says, okay, this patient needs the wheelchair for its daily use. It's very depending on the airline, but they do permit this type of batteries to go on a plane with no issue.
For some kind of products, and in another cases, we have wheelchairs that you can attach the battery, remove the batteries, and bring with you.
In terms of weight, for a parent who has to take this out of a vehicle because it's quite heavy for some, what options do you all have?
For users, caretakers that cannot, yeah, because of its weight.
The product is very heavy. It's very heavy. So it depends. We have products that we have removed. We can remove the batteries and fold and put in a cart. It's easy. But we have another kind of products that they are for external use, outdoor use. So you need a ramp or 4 people because it is very heavy. For example, we have all-terrain power wheelchairs. In those cases, we need a ramp.
Can a normal car hold the weight of those wheelchairs? Yeah.
Yes, usually powered wheelchairs here in Trinidad, I'm sorry, they use kilograms or pounds? Pounds, right? Or kilograms? Kilograms. Both? Yeah, these products with the battery included, they weigh about 140 to 160 pounds. So it can be basically the weight of one person.
But the outdoor,
Yeah, that's gonna
375 pounds.
Yeah, for the wheelchairs that are more specific for outdoor terrains, they can be very big and very heavy.
You have a big frame plus batteries. So the batteries sometimes it's more heavier. They are heavier than the frame. Why? The battery is like tanque de combustible,
It's like the gas tank.
the gas tank
It's the
of
heart.
the car. Yeah, it's the same. It's the gas tank of the power chain. So if you have a small tank, less capacity, less development. But if you have big, more capacity, more development. Depends on the product and depends on the activity of the patient, of the role of the patient.
Yeah. So
Remember, yeah, the big ones, heavier.
going just back to your question to answer it, sometimes you would need a ramp for these heavier wheelchairs, but other powered wheelchairs, you can take out the battery, you can collapse it, and they're going to be more portable and easier to move.
So one of the questions that I get asked a lot, right? We're dealing with the weight of the wheelchair. What about the weight of the patient?
When it comes to powered wheelchairs, if they have the capacity, yes, the capacity for this type of wheelchairs, they can go all the way to 300 to 400 pounds, right? So the capacity, the weight capacity of the user is usually not an issue with these wheelchairs because their frames are very reinforced. So when it comes to weight, unless the patient is extremely obese, then we will have to look through other options. But usually, powered wheelchairs in general, no matter the model, they're going to hold the weight of the user with no problem.
But for example, the most foldable, the folding or most compact wheelchair, power wheelchairs, the weight capacity is 250 pounds. Yeah, but it is normal. I think it's a good weight.
So if
Capacity.
somebody is say 230 pounds, is that okay? Or 240, is that okay? No, it's not. Yeah.
Yeah, usually the recommended weight that a manufacturer has, it could have a plus 30, minus 30 lenience on its weight. But try to make sure to always respect the guidelines that the manufacturer has because they're there for a reason. You want to make sure the product is going to be safe for the user and
And
vice
avoid
versa.
warranty.
Yeah. Yeah, also powered wheelchairs usually have enough traction to go over heels. So that's another question that many people have is that can my wheelchair go up, let's say 85 degrees? Maybe not, that's too extreme. Usually these wheelchairs will give you a range of degrees when it comes to tilt that they can go through ramps without no issue. But usually, let's say from 0, that's completely flat, all the way to like 60, 75, that can be depending on the model, but they can go up ramps of that degree with no problem. Any other questions?
Back to maintenance, right? How easy is self-maintenance, or the product has to go back to the company in terms of maintaining it?
Her question was how easy it is for a user or the caretaker to do self maintenance on powered wheelchairs. When it comes to cleaning, that can be done by the user or the caretaker with no problem. But power wheelchairs, we have mentioned before, they have a lot of moving parts. The motors can be very specific to take care of. So we do recommend, I think Laquis has a program for maintenance. So always talk with your distributor and they have a specialized team that can help you. They can go to your home, right, too?
Yes. So we have a biotech team that are trained in all these equipments, and with the warranty, once you give us a call, either at your store that you purchase the item at, or the technician you call personally, they will schedule a visit to the family's home, or depending on the issue, we may have to bring it to our head office. And from there, we do the maintenance. We recommend certain if parts need to be changed, we reach out to the supplier. We do all those checks.
Yeah, always make sure that if you have a question, ask the right person, right? Because maybe you want to do a fix by yourself and you end up ruining all the electronic system. So always make sure to, well, Laquis has a very capable team. So something as simple as cleaning that can be done by yourself, but we do recommend for more specific maintenance needs to be seen by a technician or a specialist.
On to the road. What terrain would you say you can use it on? Because here in Trinidad, we have gravel roads, we have smooth areas, we have rough areas, we have sandy areas. Can it be used, the outdoor one, can it be used in those areas?
Yes, the outdoor motorized wheelchairs, they're built specifically for that, for them to go through gravel, to go to grass, to go to dirt. Maybe mud can be a little hard, but they're specifically designed to be all terrain. They can be used at home.
One video. We have different. Remember we mentioned Magic Mobility. Magic Mobility is 4x4, literally 4x4. So I can show you a video.
It depends also on the scooter you purchase. Some scooters are outdoor, but there are different levels of outdoor.
Yeah.
The user has to tell us what they're using it for or where they're using it in order for us to recommend the right item.
Yeah, yesterday we had a user that was interested in a powered wheelchair. So one of the first questions we asked them is, what type of use are you going to do with that wheelchair? Are you going to go to the park? Are you going to go outdoors, or are you just going to use it indoors? Because that way we can recommend what type of powered wheelchair they will need. Because it will not make sense for us to recommend an altering wheelchair if the user is going to be in their home all the time. So that's why there's a long range of products that are going to be designed for specific needs. But going back to your question, all-terrain wheelchairs, I'm gonna show a video when it loads. They can be used in hundreds of different types of terrains with no problem. Another question? Let's wait for the video to load and you'll see an example of that.
We have
5 options. So depends on the ground, on the terrain, depends on that, we can choose. But here, for example, we have one option that it is in standing, and you have suspension in each wheel. So you can rise steps of 20 centimeters, right? But it's not for grass or
Outdoor use.
out 100% outdoor. Okay, is that one. De audio. No, tienes que subirle aquí. Can you hear? That is one option. Pero está hablando mucho del standing.
I don't think they're hearing me well. You just need to explain it.
Yeah, no, but it's talking about standing. I will show you just the whole terrain. Vea Magic Mobility. Con Laquis 8. So that is 4x4. The primer video. So it's more seen than there. Snow, sand, everywhere. That chair has 4 motors, not 2. The normal is 2. They have 4. No, it's okay, dale. Snow. Rocks everywhere. Laughing. It's very stable. With different power options, power seating options. It has, how can I say differential? Differential. So lock the wheels as the car. So you unlock the wheels, so push down one side to another and continue with the driving. Continue driving, sorry. Has elevator, seating or elevating, seat elevator, 12 inches. Anywhere, as where you want to go.
So yeah, this is an example of basically a 4x4 motorized wheelchair. It's going to have motors in each of the wheels. It's going to have great suspension. So I guess here all of the terrains are going to be covered. You can go to the beach, you can drive down the sidewalk. So yes, the options are very varied. You can have something very simple for home or something all the way 4x4 for all different terrains. Any other question? Perfect. So we're going to have a little break now. We've seen a lot of topics, and I want to thank you all for your questions and your activity. It's going to get a little bit more interesting now that you're going to be able to touch the products and do that. So we'll be back in 15 minutes. Thank you. products. You guys are going to be able to do adjustments. You're going to be able to see all of the features up close. So after we finish with positioning, we're going to separate you guys into groups so you can start seeing the products up and close and have it be a little bit more interactive. So I'm going to pass the word to Giselle.
Well, yeah. So, continue with the importance on your roles. Remember, it is important. All of those things are important because you have to know the technology, the updaters on technology, because you are the voice of that patient, right? So here I want to share with you a video. Some of you saw it yesterday, but it is very interesting because the World Health Organization promote that video to be conscious about the importance to adjust or to give the correct product to a patient. So I can show, I want to show you this with you, share this with you.
Having a training and the use of the chair is very, very important. It's important that having a sitting, make sure that the size of the chair is really what the person needs. Without proper training, then you will always be like, I'm afraid I'm going to fall, or I'm afraid that this chair is not sturdy enough to carry my weight. You have to develop the kind of self-confidence based on how you learn your chair.
The development of the course is being done in an effort to provide the tools that the participants need to be able to take these types of programs back into their local communities and strengthen and grow and sustain services for wheelchair users well into the future. I have an easy job, and that's providing the resources to you for the work that you're doing on the ground. And so it's actually an honor on my part to be there, to see the programs, and to be able to provide support.
What? No hay ni una.
Ah, mira, no me funciona.
No sé, creo que no. Great, nice, right? So, continue with the presentation. Okay, important steps. Fit the product. It is very important to fit it because you receive the product, but it's not fitted. It's not just take the product and go. See you later. No, 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 no. We have to fit. We take OT most of the time, take the measurements and prescribe. I'll do a prescription, but we are human, so we did mistakes, right? We can do mistakes. So we have to fix, for example, if the patient has, I don't know, more need more lift in the chair, depth, sorry. So we have to adjust it. More long the leg rest, we have to adjust it. The support, the trunk support needs one up and another down. We have to support it. You have to adapt it in a wheelchair or in any other device, in a standard, in a pacer, whatever. So why it is important? Because we have an anatomy, we have the form or design of our spinal column in a specific way because we are bipedals. Bipedal, how can I say bipedal? Bipedal. We are bipedal, right? We know our quadrupedal, like our dogs. We walk in two legs. So we need that design, that form, that curves. If you increase that curves, produce damage, pain, and disorders. So in this area, we have to take care about the spinal cord because it is inside of this, right? So we have very nerve ends exiting from here, and if you change that word, that curve, affect the function, the sensibility, and the mobility. It's the same with the pelvis. If you have the pelvis with an incorrect position, you will have problems on the column, on the spinal column. So, for example, I have questions for you. Please show me, because I need to do it more interactive, show me one posture of the pelvis. One. Who wants to do it? Volunteer. One posture on the pelvis. Who? You? You? Good, thanks. Wow. You can. Come on. Could be neutral. Could be neutral. Ah, another volunteer. Okay, thank you. Yeah, good. Good.
All right.
Neutral. Neutral? Okay. Another.
Say something like this.
What is that? Yeah, on the sacrum. What is? What? Ah? What? Again? New. Muy bien. Very good. Posterior tilt. Thank you. Woo! Thanks. Another. Posterior. Neutral and posterior. Two more. You. Pelvis, right? Remember, our base is the pelvis. Is lateral tilt? Or can we name in another word? No, the pelvis. We saw it yesterday. Obliquity. Good. Obliquity is one pelvis up and another down, right? Thanks. Other. We have posterior and anterior. And the other one, the last one. So you mentioned posterior, anterior, obliquity. What is the other? Rotation. Woo! It's excellent. Rotation. Okay. So the position of the pelvis, as it is the base, command to the spinal column, right? So if I do as, what is your name? Stephanie mentioned, you could produce scoliosis, right? If you have rotation, what produce? Come on. Now here, it's, I think would be better here, right? So if I have rotation, what produce? What is that? Rotoscoliosis is rotation with scoliosis. And it is very common, right? It's very common to see the patient with rotoscoliosis and the head out of the headrest. So here is a resume. So if you have posterior tilt, is related with kyphosis. If you have anterior tilt, is related with hyperlordosis. And if you have obliquity, scoliosis. If you have rotation, rotoscoliosis. So if you see, all are related. Association. If you have wrong position in pelvis, you will have consequences on the column. Okay, and of course, all organs inside moves, right? So if you have problems with digestion, maybe because of that. So if you don't move, you lose control, you lose movement, you lose function. So it's the same with the organs. If you don't put in movement that organs, they lay out. Hey, well, okay, I'm fine. You don't need me. I don't need to work. I don't have to work. So it's because of that is very important, the therapy, right? The rehabilitation. So this we have typical wheelchair positions. Here, what is that? Posterior tilt, right? Kyphosis, sacrum, pressure on the sacrum. So we have the neutral, the normal or neutral. We have here mega anterior tilt, hyperlordosis, and a combination. Okay, here we have obliquity. We have rotation. It's common to see one leg shorter than the other one, right? And it is associated with luxation of the femur, right? And we have windswept case. That is this one, right? Windswept. And maybe you will need supports like an abductor and adductor and align the femur and helps the pelvis to be in a good position. Okay, just with supports. But for example, if you have a client that jumped that support, maybe you will need an external abductor, and it is put it on the seat plate. It's bigger than this, but sometimes with that, it's very easy. You can put the cover and nobody knows that you have supports there. So it's more statics. Now you have the luxation and limb length discrepancy. As you see it, luxation on the left side. And here you have flexible deformities or fixed. When you have fixed, nothing to do. Just prevent that they continue. Just to prevent. Because if you don't put anything there, don't put any support, they can increase. So you have to put it, you have to stop it. And inflexible, you have to reduce that damage that we are in process there. So how? You have this test is the FUM. What is the name? FUM. La Jiva? Hum. You have the hum here, and it is a sign of fixed. So if you have that, you know you have a fixed deformity there. So we have secondary injuries, for example, contracture, flexion contracture on the knees, flexion contracture on the pelvis, windswept, abduction or adduction, right? Here we have the example there. We have a combination there. Is windswept with rotational, with obliquity, with rotoscoliosis, a combination, right? And it is very common to see it. Yes, it's very common. So here's the map. This is, for example, a client with dystrophy. It's very, because they are hypotone, so it's very complicated to work with that, but he needs a lot of support. So skin assessment, remember, you have bones and prominence that you have to protect because they are in risk. How do you determine when a pressure sore is in level 1? How do you know that? Do you know? Come here. Come here. Come. You can. Woo. Come on. And for the light. Okay.
So you notice the skin breaking down, and before the breaking down of the skin, there's also like discoloration before. That's it.
Yeah, good. Thank you. So you see that discoloration there in the area, and you put your finger there. Okay. If you see my hand, see it when I put pressure there. What happened? Is white and then red, right? White and red. When you do this and you never see the change, always is red, always is with another color, it's a pressure sore level 1. Okay, so I need to change something urgently. But if you have some red points because the trunk supports or pelvic supports, say the mom or the father or the parents say, don't worry, just check that part for 30 minutes. After 30 minutes, it continue with that color, do the test. And if it doesn't happen, remove the support. But if the color disappear, don't worry, it's normal. Because most of the time the parents said, oh no, poor my son, it's a lot of pressure, I have to remove the trunk support, and then the scoliosis. So and then later they said, oh, he has more scoliosis, the curves goes up. So what happened? Oh, mama, you are removing the support. We need that. For example, if you have an scoliosis and you have to correct, to fix it, how to do it? If I don't know, let me check. Choose one person, then. See, choose one. Come here. No, I have an scoliosis. Where do you put the supports, or how? With your hands?
Usually at our work, we usually put a brace. So the brace is usually supported around the patient, positioning the patient to level them off. So, sorry. So the brace usually supports the patient back and around the patient, which aligns them in the correct position that they're supposed to be in. So that they
okay, are you agree? Go here. Are you agree? Yeah, you see the hands? Where she put the hands? Where?
Under.
Again. Okay, one up, another down. What is the limit here?
They just use under the arm. They have the measurement.
What is the limit? At least 2 fingers, yes, at least. Yeah. And it's correct if I put the trunk support here? Here, it's okay? No. Always bones. Okay? Always. Never organs. Always bones. Excellent. And now, I have a challenge for you. If I am fixed, where do you put the support? If I am fixed,
If you're aligned straight,
I couldn't. I'm fixed. It's a structure.
She's fixed.
I'm fixed.
oh, just change the position of the patient. Okay, rotate. Just
I'm fixed. I'm fixed.
I have to rotate the patient, fix it, twist. Well, you
Good, thank you. Okay, thanks. If I am flexible, and I have this condition, okay, we have the support, the trunk supports. Okay, check, good. What happened with the pelvis? Remember the pelvis command column. So I have to work first on pelvis. So if I have this pattern and I am flexible, where can I put the obliquity path? Here, here, and good, very good. Because if I put here the obliquity support, I correct, I do the balance, right? So I can help the column to be in a better position. What happens if I am fixed? Where can I put the obliquity support? It's the same, but I am fixed. Where? Here? Why not? Why not? Come, come. Why not? Dice, I don't want to talk. I don't want to participate because I have to. Yeah. Exactly. No, on the pelvis. Where do you put the obliquity support? If I put here, what happened? If I put here, see it. Using this, for example, I put the obliquity support here, and I am here. What happened? Just on my goes up. More space here. So remember, I have to be a print of the pelvis and the back, always on cushion and backrest. I have to print every part of my body. Why? Because I need to prevent or reduce the pressure source, the pressure point of pressure, right? So if I do this, just increase that gap, that space. So I have to put something here to let the pelvis knows that he can rest, right? And do the complete print there, right? The same thing here. If I am a structure or fixed, I need to stop here, that curve. I need to stop there, and then stop in that side the same level because I can continue. Whoop, pushing here and down in here. So I need to put it there. I'm gonna need to push a lot because I cannot correct anything. This fix, just put support to prevent or to avoid increasing that. Okay, is it clear? Great. So in those cases, just check, remember, check the red points. And that is resulting of alterations. So breathing, feeding, digestion, swallowing, bowel movements, very common, right? Because if you don't move, you are in problems. So participation limitations, very pure social skills, and functional limitation. Of course, they can do many things, many activity in the day. So the other alterations are in food deformities like echinus, varus, valgus, pronation, and supination. Of course, pain, fatigue, and sitting intolerance. So patient that it is crying and crying and crying during the day, check the red points, check the cushion. Maybe it's on a cushion like this with contour sitting on this part. I don't know if you are seeing some patients that use this or use the external abductor like a stopper. It's like the mom said, no, I need it. The kid is like this, but I need it. I need it. Why? Why? Because he stopped the sliding. It's not doing for that. It is abductor for the knees. This area is so sensitive. You don't want to stimulate anything like that. Infections, pain is not good. For this area, we have another options. Then don't take, how can I say genitals?
Yeah,
Genitals. So we have another options. A good position of the seat of the belt, another type of belt. We have another things, not that. For example, do you have a belt? ¿O tu cinturón? ¿Tú andas cinturón? No. Sí. So I will give you an example. And I am sure that you see this many times a day. Come, tú eres mi cinturón. So when you put the belt on the pelvis, always you put it there. It's very common to see the belt here, right? So put it as tight as you can, please. See me. I have posterior tilt. I can't, right? I can't because it is put it in a wrong place. If I put this after the head of femur, see it. And I tie it in a correct way, see it. It's difficult to me to do it, right? It's difficult because it's in another position. It's 45 or 90 degrees. If I have a patient that has a lot of force, a lot of strong, it's very strong, so I need more support, maybe 4 points belt, I need it. So points here, supporting here and here. So I prevent that movement. Okay, but not use the abductor, please. Oh, pow pow. Thank you. So that is regarding to positioning. Do you have any comment or question or something to add? No? So now we are going to explain you some products, and later I want that you practice how to adjust it. So because you have the knowledge now and you can adjust some things that you see wrong on your patients.
So first, I want to talk about this very special tilt in space wheelchair that is made by our own brand. Our own brand is named One Low. It's very interesting because here in Latin America, you know, the prices of products, for example, from Sunrise can be very expensive, all the way to $2,000, $3,000. So we offer this very economic option for a tilted space wheelchair that can be adapted for pediatric patients all the way to adult patients. As you see the wheelchair, this is how it comes. It has an integrated headrest. You don't need to buy a headrest separate that can cost all the way to $600. It is depth adjustable, angle adjustable for the headrest. You can also adjust its depth. And as you can see, I don't need any tools for this. I'm doing this all with my hand. It's just tightening and loosening screws. Also, you can adjust the height of the headrest very easily. So when it comes to users, you just take your measurements and you can adjust it as is. You don't need to order it for a very specific configuration. So let's say over time, an adult or a pediatric patient has different measurements. Well, you can adjust it very easily. As you can see, it does its tilt and space function. It's kind of getting up because there's no weight, but you can adjust it to an angle of up to 45, right? 45 degrees. And the backrest can also recline. So you have both functions in this wheelchair at a very accessible cost. Yeah. Something very important with tilt and space wheelchairs is that they have anti-tips. This one has them integrated. You just pull them back because it is very important when you're doing the tilt in space that the wheelchair does not fall, right? So this prevents for the wheelchair to fall back and maybe cause an accident. So it's very important for a wheelchair to have the anti-tips. Also, you can see here we have angle adjustable leg rest. You just twist the knob over here and you can adjust the angle very easily. And you just tighten the screw and it locks into place. So you can see it's very easy to adjust the angle. Yeah, if you want to come closer, you can go ahead. You guys will have the ability to play with the product in a bit. Also, they are removable. I can just pull them up, pull them to the side, and I can remove the leg rest completely. Just pull it up over to the side, and it comes out completely. The arm posts are single post. They are height adjustable. I just pull this lever over here, pull them off completely, and if I want to adjust its height, there's an Allen key screw that I can just turn, and there are different sockets, so you can adjust the height very easily, and it just slides into place like this. And just, there you go. Something very important that this wheelchair has that is not usually offered in other type of tilt in space wheelchairs are the lateral supports. The lateral supports can add up to 2 inches of each side, so you can reduce the width of the wheelchair by a total of 4 inches, and all you have to do is move them like that. And then you just grab a little Allen key and you just screw it back here. And now you have 2 inches from this side, you can have 2 inches from the other side, and you reduce the total width by 4 inches. The caster wheels are removable just with the press of a button. So I press the button and I can take out the caster wheels in case you need to clean them, replace them, etc. Let me put it back on. There you go. So this wheelchair is very accessible for all types of users because you don't need a lot of tools to manipulate and change the angles. You guys are going to work on that in a little bit. Something else you want to add about this one?
No, just remember, this is an option. First, we are offering you another option that is fixed. But we have another option. We have CPI, they are very excellent. So remember that just as much when you have more degrees of tilt. Because here we have 45, with diaries we have 60 degrees. So much degrees, more change of position, right? It's more pressure relief, more change of position, better for the patient. Reduce the tone, control the functions of the body, and a lot of things, a lot of benefits. So that's
Pasar de la ¿no? Sí.
okay. So now we are talking about this product. It's also from our own brand, One. Okay, the name is Coyote A. It's like active chair for active users. For example, I can tell like those users who have like, what was the name?
Athletic? Oh, spinal cord injuries.
Spinal cord injury. Okay, when they are active, they have good control of the trunk. Okay, so let's discuss the chair. It comes like you see it. Okay.
Lo que les voy a poner a hacer.
Holding the backrest, okay. Also, it will depend on the position.
Lo que les voy a poner a hacer esta desarmada y que la arme y la que la compre viceversa.
Los laterales de ropa. Side guards.
Side guards.
Okay, you can remove
Sí,
it.
esta se la voy a dejar desarmada y la otra armada y que...
Okay, you have the center of gravity that is adjustable. Oopsie. I have to start again?
No.
Okay, good. Also, I don't know what happening here, but normally it's not like that. But you can remove this as well.
This one isn't the perfect one. We have have a good one downstairs. This is our demo.
Okay, that's great. And you can the foot, yes, you can adjust it in the side that you want. No está bien enganchado.
This only comes in a size 18-inch wheelchair, correct?
Exactly. It comes in two sizes. Actually, that's the only. It comes like 16, 16 and 16, 18, I believe,
come
right?
you don't do a
16 by
20?
16 and 18 by 16.
How come you don't do a 20-inch?
No,
We've
we
got
don't have
requests.
yeah,
to do 20.
another model.
Okay.
Just this is one law, but we have a lot of models on Sunrise. So and with another different aluminum alloys. So this is an option, an economy option, but we have many models that we can adjust at many sizes that you need. This is because
I don't know why.
It's because it's in another way.
Okay, here we have the brakes, right? And the wheels, let's talk a bit. The wheels come in 24 inches. I forget the name of this in English as well.
handles.
The handrings, okay, it's like aluminum. Sorry, I forget that this chair is aluminum wheelchair. Okay, it's really light, as Hismar explained before. And the casters are in 5 inches also. It rotates, as you can see. And I don't know.
The casters are in aluminum black. So it's not plastic, it's aluminum. It's lighter and
I think the only plastic is the side guards. So it's really lightweight, as you can see, really active. Yeah, ya lo hice. Yeah. You can recline and try. I showed you before. And you have a little backing here. That's great if you want to put something, your cell phone or anything. And also the cushion, this chair could come with this. Yeah. Well, we have any cushion like available now. But
We sell ours with the one row cushion, but it will adapt to anything.
exactly. So, anything else you want to add?
who you recommend this? What kind of patient? Very active patient, right? That spinal cord injury, amputees, apharesia. Apharesia?
What about a child who's attending school where it doesn't really have room for a normal wheelchair?
Depends on the child's ability.
But we have a patient with LOH, coyote, normal one. But sometimes it's a bit difficult in the classroom to move about.
Because it's big.
That's one.
But why he can't move?
The classroom.
Ah,
But what's his issue? Can he use a regular wheelchair or does he need a different wheelchair? You know,
She can use she can use what happens is that she was born with the legs.
Okay.
But she can use a normal wheelchair. It's just that the school, she's going to high school, and it's very difficult to move about.
That's the environment, that's not the wheelchair or the child.
Yes,
Yeah,
but
so
that
with this
wheelchair
thing-
is not made for self-propelling. This one is.
Yeah.
This is more
Yeah.
independent.
So
People,
that's
so
what I'm
it's
thinking.
lighter.
Yeah.
Remember,
This is-
you
and
have
it's
to
lightweight.
you have to
this
move
one is
your
actually
weight.
smaller than the normal.
That's the way. This is much smaller.
yeah.
So I'm thinking,
El inset de esto se puede cambiar.
Remember, the patient needs to move his weight and then put more weight there, a lot of effort with less muscles, smaller muscles, right? So the idea of this is doing this or giving this to a very active patient because it's less effort, it's lighter, so it's easy to me move and be more maneuverable. Oh, sorry. No, I touched this. They can they hear? Okay. Yeah.
Is it green?
Is it green?
Oh yeah, it's okay.
Thank you. So when you have standard wheelchairs or common, maybe if you are a very active patient, you don't have the legs in that position. You have it there, right? So remember, you have the control here. Your center of gravity is here. The center of gravity of the chair is here, and a weight there. So, do you use a market card? Market
Yes.
shopping cart? Yeah.
Yes.
When you put a child in front of the shopping cart, it's very difficult to drive, right? It's the same. You put weight there, so you have more distance, less control to maneuverable the chair. So in these cases, when you have a very active patient, you need your weight near or close to the mass of the body, close to the center of the gravity of this chair. What is the center of the gravity? This one, this. So if I am here, or if I am here, what is the center of the gravity of the chair? It's very backward. I need it forward because I need to have my mass, the mass of the body, center or close to the center of the gravity of this wheelchair, because I am very active. I have control of my body, of my extra weight, with my less muscles that I can move. So if you do, or if you give a standard chair, is limited the freedom of the patient. So, but if you have a patient that is not very active and needs a lot of supports, you can use it a folding, because he moves the chair maybe, but it's not very active. He or she just need move the chair sometimes, but be in a good position. So you can have this because you need a good position of the leg, because if you put it here, maybe contracture, right? So you need mirror position. But if you have an active patient, you don't need that. You need have given them independence. Yeah. Is it clear? Hi. Yeah, and you can try it. You can use this and then use that. It's like, oh my God. So remember, here you have less mobile parts. So the energy is focused on drive. Then your energy is maybe focused on move everything. Yeah, and it is aluminum and it's very light, considering it's a standard wheelchair. It's light because it's aluminum. Remember, steel is heavier. So here, let me see. I have a lot of distance here. So I don't have control of my legs. They are there. So I want to select every parts are moving. Like less control, less maneuverability of the chair. It's not good, but it's not for the same patients. It depends on the diagnostic.
So that one is folding, right?
This is folding, yeah. Okay, so in this case, we have this option that it is compact wheel locks. It's easier to lock. Sometimes we ask for scissor wheel locks, that it is more, oh my gosh, ya me estoy bloqueando. It's an option. Scissor wheelchairs is an option, more common to prescribe, but the patient has to have some control. For example, if I have scissor is like scissor, and you have to go here and pull the brace of the wheel lock. So if the patient has poor control or a very low injury, very low lesion, maybe can do it. But if the lesion is very high, has less control. So have to put the hand here and because maybe fall down on the chair. Yeah. So in those cases, it's very this because it's just push and release it. It's simple. And I think that's it.
Yeah. I didn't mention also, for example, we can.
Yeah, quick release. It is quick release. Alza la silla. And it is, oh, sorry, it's lightweight. Sorry, it's lightweight. So,
And also the
less
casters,
than the
right? We can
others.
move the casters. They are adjustables. We want to change the side.
Yeah, if you change, if you want to change the front seat height, a rear seat height, what I decide that. Why? I need more front seat height than rear seat height. Why? Yeah, because I need some tilt. It's not recommended for us to stay 90 degrees all day. Because of that, you do posterior tilt. We do it. We do it all day or every day because of that. But because I have the weight of the gravity. Because of that, we are on 2 feet, right? And the 2 feet. So the weight of gravity maybe or sometimes affect us because if I don't have the strength to put my trunk in a correct way, maybe collapse. So I need to take advantage of that weight of the gravity in my benefit. How? Doing fixed tilt is this one. It's like this. See it? Like this. If you do that, you will feel comfortable because the weight of gravity helping me to put it in rest. So it's the same with the patient. Don't push the patient doing always that effort because they don't have the strength to do it. So use the gravity in advance as benefit. Okay. So that it means that you need more height in front than in the rear side, in the rear part. And that's called fixed tilt because it's tilt, but it fixed. You cannot move it or change it.
Giselle, and my manager Anika had a question. What do you?
Give me a sec.
So as I was asking before, right? We have the LOH chair, which we watch the wheels, the tire, and then you have the one that just shows us the active one. Compared to the wheels, we will recommend more of that one for the road for people, the LOH normal one. But this one active, the material, the wheel, the tire. How long would it last? How it active? And how often you have to replace the wheels?
Depends on the use, but we have differences. Yeah.
Any
We
other
have
questions?
differences. Here we have a straight spokes. Straight, right? It's ultralight, but we have another ultralight models. Where is this escape? This is fixed or straight spokes. This is two, but with more spokes, but it's the same, okay? So when you have this kind of wheel, it's better because absorb impacts better than others. See that standard chair, these are cross spokes. See it? Cross in the same plane. Here, they are cross. See it? Here, in the same plane, they are in cross. Straight. So it's different because of that. If you have a standard wheel with unique stability, less maintenance, right? So this is the most rigid, but absorb less. So that is the difference. What happened here? You have aluminum ring in another standard wheelchair that we don't have. Yeah, we have it here. Not the same, but here you have aluminum ring. Yeah. So when the movement every day, this is always straight. always strong, okay? You don't have move there. But here, when you have a Mac wheel, this is plastic wheel. With the movement, you will experience movements, lose the tight. So sometimes you will have two standard wheelchairs, but just with this, you will have more lifetime than the other one. So the other one, the Mac, you see the wheelchair is like for everywhere. So it's very difficult to propose and to use for the caregiver. So in these cases, few things to change make the difference. And that is the idea in our products as one law, is doing products with more life, so more functional for more time. Is it clear? Yes. And thanks for your question.
What is aquí? Así. Perfect. So besides from wheelchairs, rehabilitation products are very important. This one that we have right here is called the Rifton Pacer Gait Trainer. It's usually seen a lot in personal homes of users who have some kind of ability to walk, but need that extra training for them to use their muscles and to improve their walking conditions, right? It's also seen a lot in therapy clinics. So I guess it's something that is very important. Something very useful about this Rifton product is that every part that you see in white, it means that it can be adjusted. For example, the height, I just pull this lever and I can adjust the height of the Pacer trainer. Why is this important? Because, for example, let's say I am in a wheelchair and I have the ability to do some kind of movement with my legs, and I have to do exercise and I need to walk. So I can do the transfer very easily. The Pacer Gait Trainer can get up to here. You can adjust its height and its angle very easily. So let's say I need it over there, and somebody can help me and like do the exercise of grabbing me, and the transfer will be almost instantaneous, right? This is not my size because I'm a little too big, but yeah, this is a medium. I will have to use a large. But as you can see, this multi-position angle is very important because you can adjust it to the exact size of the user. You can change its depth, its height. It's very easy for the parent or the caretaker to do because they just need to press the white levers and it moves, right? There you go. You can adjust its angle, you can adjust its depth very easily. And its accessories are very varied. In this configuration, it comes with its armrests that are strapped with Velcro. So in order to train the walking, let's say I get into the Pacer, I put my arms over here and I can do the walking training, right? It doesn't look good because I'm too big, but let's say for a kid or a pediatric patient, this can help and stimulate the walking, which is very important. This is the posterior configuration, right? But it can anterior configuration, but it can also be configured for
When you
posterior.
configure for anterior or posterior walker, what determine that? What kind of thing determine when I choose anterior or posterior? What? What condition of the patient? Maybe, yeah. What more? The pattern. It's a pattern. If you have a pattern of flex pattern, what do you recommend? Anterior or posterior? Both. Anterior? Anterior. Okay, I will show you. If I am with a flex pattern, maybe I will do this. Right? Always there.
Remember, this is not a walker. This is a K trainer. So I have to train how to do it in a good way, right? So flexible like what? Whoa. Here, push, right? If I have this, I recommend here. Why? Because if I am flex, I need to do this. Here. I avoid the flex. So I stimulate the extension. Okay? So if I have obstaculus or extension pattern, I recommend here. Why? Because I need to stimulate these muscles. So if the pattern is this, I need to do it. Okay, push. See it? I have to contract this. But here, to avoid that or incorrect pattern. Yep. And here we have a lot of support. This is platform. It's designed by people who need a lot of support here. So we have to put more stronger. So it is flat because of that. But you here you have, for example, a chest front. This is the chest front. Yeah. Okay. So you have chest front when you need more support on the trunk. And I think
Yeah.
the resistance.
Yeah, the wheels are very important. As you can see right now, they're completely free, but you can lock them to a specific position just by pressing this button. And now the wheel doesn't move.
Unidirectional, bidirectional, or multi-directional.
So if you want the user to train is his walking forward instead of in different directions, you can just lock the wheels and I can only walk forward. I cannot, well, if I lock the other wheels,
Oopsies, not your size.
so if I lock all of the wheels, now I can only train forward. So I cannot move to the side. So depending on the type of therapy the user is going to need, you can easily adjust the wheels, the direction of the wheels, and not only that, you can also adjust its tension. So let's say the user, after 3 months of using the trainer, you can see that their ability to walk has improved, but you know they can still do progress. Well, you can easily go over here and adjust the tension of the wheel. So the training can be continuous over time. You're not limited to, let's say, after 3 months, the user has shown progress and he outgrew the product. Well, no, you can easily change the tension of the wheels, directions, and do different types of trainings that in some products may be more limited. Oh, yes. And as I mentioned at the start, everything that is white means that it's adjustable and you don't need any tools. I have not used any tool to adjust it. So it's very easy for people in the therapy clinics to do the adjustments, not only for one specific patient. So if you have multiple patients, you can easily adjust it, just pulling the levers and adjusting the buttons.
So let's talk about this. Sorry.
This particular gait trainer, is it used for a flexor pattern or for an extensor pattern? So this gait trainer, is it used for a flexor pattern deformity or extensor pattern? For both.
I can use it here or posterior. Put in this here.
So you reverse the knee brackets
Yeah,
forwards.
this one just for a heel. This one just the side. But the rest of the parts you can adjust for posterior. Very easy. Here you can move this. No rules. It's very easy. For example, you are in your clinic. You have to receive another patient that needs here. Just put this in front. Put it here. I move here from here. So posterior or anterior. Very easy.
Any other questions?
Dale. I'm sorry. Weight. It has 4 sizes, and in the weight.
You always with the patient. Depends on the size that you choose. For example, this is the medium, so that is the limit. But you can
I think the maximum weight on the biggest size is about 250 to 300 pounds on its maximum size. So in order to determine which size the user is going to be, you have to take the measurement of the user standing and from the floor to their elbow. So that's how you know what's going to be the maximum size.
Sizes by height, correct?
By the
Not by
elbow.
total height. In order to find the correct measurement for the lead trainer, you have to have the user to be as standing up as possible as they can, and you take the measurement from the floor to the top of their elbow. That's how you know which size you can choose for the pacer.
You see the dynamic system? Did you see it? When you walk, you don't walk like this, right? You don't walk like this, right? You walk like up and down, and move. Good. Some of you moves than me, but you walk like this, up and down, and lateral movements, right? Like, right? The normal, like a map. So now you can choose here in the patient because some patients need that movement to walk.
Yeah.
Maybe apoptotic, right? Needs that movement. So you have here the dynamic systems here. See the way how it moves. This up and down and lateral. So we allow the patient to move because the idea of patient weight trainer is to promote walking as soon as possible, as the patient can do. And then you can correct on the way some patterns. But that is the idea. Very nice. And you can lock it if you don't want.
Ready? Okay, let's talk about another Rifton product. Okay, here we have the HTS. It's like hygiene toileting system. Okay, it's for using in the bathroom, right? It give the user like comfort and stability in the bathroom, and also the caregivers is easier to clean and everything. Okay, so let's talk about the components. First, we have the headrest that is also adjustable like this. We can move it. Also, this type of all the Rifton products are without tools. Exactly. We just move it with these old buttons. Here we have the side supports that also are adjustable. So it will depend of the size of the. This one doesn't want to move, but you have it. We have the tray table that we can also remove it. And here, this is also great because sometimes even the user needs to eat there and we have to wait for the digesting system, you know, to all the work. And then we have this that we can be removed also. Okay. And let's talk about the pads. In here, we have a few options. I think it's 5 or 6 options for the pads. It could be open, it could be closed. It will depend on what the user needs. Esto es del armrest, ¿no? ¿Y por qué me quitaste los armrests? Okay, here we had the armrest as well. And we don't have it anymore. We can remove this. Okay, this option here, that the pot is the name, I don't know. The pan. You can choose it or not. It will depend on what you want. It could be easier. You remove it and clean it, or maybe sometimes. This one.
But the idea of that system is to have two in one, for back and for because it's easy to clean,
Exactly.
Always,
Okay.
Uh,
Impermeable.
waterproof, the top, the foam, very soft, but it is closed cell. It means that if you crush the foam, you never will have water inside of the foam.
Sí.
Closed cell. It's patented
Oh, cool. No sabía. Okay, look, I didn't know this. Also, you can move the sides in height. Okay, so let's keep going with. Okay, it's important to know that the height of the chair is also adjustable. Okay, it will depend. It's easy. I'm just like a bit lazy, but it's really easy. Okay, also the footrest. Okay, thank you. Is adjustable as well. Okay. Lo quité completo. Ah, I am the problem. I'm sorry. It tilts also. It is tilt. The tilt is in here. We can tilt it like in front or in the back. Ya, no sé por qué está tan dura.
Yeah, there you go.
Exactly. So it will depend on what we need.
So the importance of it being angle and height adjustable is because not all of the toilets are going to be on the same size and the same height. So let's say the toilet is at this height and if I'm the user sitting down, they can scoot me over directly to the toilet. And in this case, it has the bucket right now. So we can take out the bucket and he can use the bathroom. He or she can use the bathroom directly on the toilet. And you don't need to transfer the user from its wheelchair or from another type of seat into the toilet. He or she can just go directly to the bathroom, use your knee, it can be easily cleanable, and then they can go out the toilet with no issue.
Also, this part could be removed as well if we don't need it. Okay, and we just put the seat on the toilet and that's it. Okay, and also we have all the chest strap, I forget the belt, and the no, esta parte.
Calf straps.
So why?
So we know exactly.
This is not height adjustable, but I can remove it. And you can also attach
¿Esto para qué era?
the table. If you need to attach the table, it can just be slid into the armrest.
You can remove all the
Yeah, it's waterproof.
Yeah.
Yeah, it's plastic and foam. You can easily remove the foam parts.
all the parts of the item. Yeah, no,
Yes.
not this one, not that one.
No, you can remove all. But
Not this one.
no, not this one. This part.
Ah, no, this part, no.
The back
The back, yeah. The back and the seat
and the tray.
and the tray. Yeah, and the abductor too.
Yes, it's
So
plastic.
here, these are hip supports. See it?
And this is the brake, like very important, and it doesn't move.
And here you have push handles for the caregiver. So you can put it here.
These chairs are adjustable, as in you can just pick up based on what you need.
Exactly. You can put any parts or any accessories or components that you want. So we are showing you
All of
a
them.
lot of, because we have deflectors. Do you know what is deflector? Deflector is like this. It's like a stopper of PP. It's too big to me. Deflector is something like you put here to stop that flush. Okay? So deflectors. So you can put it here and you don't have a party side of the back. So
Also the size. To know the correct size of the user is the height of the user. Okay.
the total height of the patient. Now, when you are part of the Ismail mentioned you another use for the anterior tube. For this tilt, not the tube, I have 45 degrees, but we have 5 degrees in front. What activities? That one is one that Gisbert mentioned, translate. The other one is brush your teeth, take water. Exactly, good. Okay, it's very nice. It's a good product. It's very, very nice. All Rifton products are very good. Actually, I have 13 years working with law, and I just have to change 2 wheels, not more. They are very, very high quality. Yeah.
So for this next part of the session, we wanted to be a little bit more active. So we're gonna invite you guys to separate into groups. And you're gonna go see the products, and we're gonna do a little activity. So can you separate into 3 groups, please?
No, we're gonna
I
separate.
can give you a number.
Yes, let's separate people. Let's separate.
Okay, so 1, 2, 3. 1, 2, 3. 1, 2, 3.
Only threes together, only ones together, only twos together.
1, 2, 3. 2 con 2, 3 con 3.
So ones come here. Ones come here, two there, maybe and threes over here. On this side here. Threes over here. 3. 2 is maybe lower down.
Creo que mejor es.
1 is here.
2 is there. 3 is here.
Threes on this side here.
All right, so group number 1 is this one. Perfect. You guys can come over here. And first, I already gave you a little explanation of the product, so I want you guys to just move around, use it. But your final mission is going to be to, how do you say?
Assemble.
Yeah, disassemble it until it looks like this. It's all very intuitive. If you have any questions, you can ask any of us. But first, explore the product, and the main mission will be to disassemble it into this. Group number 2 is going to have the reverse task. What is group number 2? Perfect. Group number 2, your mission is going to be to explore the product, but now you have to assemble it into your file. There are going to be all the parts. It's very intuitive, but if you have any questions, go ahead and ask us. Yes. Excellent.
Good job. Good job.
We're finished. Yes.
You have a judge in each group. One here.
Remember, you need to use
Each one of them is individual. One of them is for recline. Is that one over there? Yeah, that's one to the
eating, maybe
yeah. This one on the other side is for recline. So that's it. Maybe since there's no weight, it's a little bit harder, but you can also do both. Yes. The other one and you can use both. Also, there's a way to fold this entire wheelchair. I want you guys to look maybe down the side and try to see how it works. How would you be able to fold it? Yeah. You can collapse this one post forward. How would you guys do that? Try to inspect one of the. Yes. What would you recommend? Yeah, there's his name. You just have to. And now. Now. Now you guys can build it again. Let's see.
So what you kind of just take it out?
Make sure this part is
Make sure you hold up this. And it's good. That's just right there.
No, carry down. Push it in together.
I was just positioning because I can't really see forward. Push it. That okay? It's like it's too short. Now,
Hold on, sorry. Trying to get the video.
and then,
Yeah.
is it possible to do it
By one person?
Yeah.
Or you always have to.
She wants to show if she can do it better.
You with practice.
So yeah, one person can do it, no problem. It just takes practice. So move him. Collapses. So this will be for transport, and I can do it by myself too. Just hold the frame. I usually use my shoulders to hold it again. Go and grab the piston, and I just align it. Do it by myself.
What's the next one?
This one is 100. Make sure to always put the lock.
Do the tilt in space. Somebody do the tilt in space with her in it. No, stay in it. Stay in it. Somebody do the tilt and recline with her in it. We want to show them the tilt with her in it.
Let's do the tail. Okay, here you have both options, one for the tail and the other for the recliner. No, I just asked you. One is for the tail and the other is for the recliner. Yes, this is this side, that's it. This one, yeah.
Yes, one down in one neck here.
And then the tail.
So other than just the squeeze.
Yeah, just the headrest.
Adjust the headrest.
This is the little one.
Yeah. If you want to adjust it,
Now you can get
all you need to do is pull it out.
They want to show them the tilt and recline with her in the chair. Comfortable?
What do
I
you
need to bring a
mean?
key so you can do it.
No, stay in the chair. Stay in the chair. We want to show the tilt in space while you're in the chair.
So if you want to adjust the lock,
Use the chair.
stick them out. Grab it down.
No, that's the frame. The frame. Will. That's recline.
Yeah, but
Now that they're loose.
the what? No, you can keep it.
Move them inward.
Here you have a little image, see? So this one
And now you have
inside.
reduced the width. Like 2 inches to the side.
Hold on, let me see this.
All right, don't work for next.
Look at that.
Sorry, Nicholas. Put on the lights.
For the people that
I'm sorry, I'm sorry.
just use your
The brakes,
hand
the brake. Oh,
and you can
It's
reduce
very
the
good
depth
because if you are on a hill,
the sides like 2
down
inches
hill,
to the side.
so you have to control this.
And also here.
You want to.
Now it's flat and flush.
That's for the caregiver.
Yeah, that's one.
So, ready?
Ready.
Change now.
Yeah. Perfect.
So, first group comes to one.
Right? This one.
Y ustedes cambian.
Ellos ya la armaron y la desarmaron.
Ah, okay. So, faltan ellos. Comes here. Group number one here. Please here. And now group. No. What group are you?
One? No, this is one. This is one. That's
Okay.
Uno from there, dos go there, tres come in.
Position one.
Every just rotate.
Group number 3 here. And group number 2 and number 1 there.
Oh,
So this group is working with the wheelchair owner, right? So your mission is going to be to disassemble it as much as possible. As you know, you don't need tools for this. So you should try to see what parts you need. Try to restore the wheelchair. Try to disassemble it as much as possible.
Vamos a rotar. Yeah.
So we have to.
Pero que uno es ponerlo y el otro es usarlo.
You're praising, you're jumping for joy on that side.
Oh, yeah, we ruined.
Yeah. That's a just high.
I just,
Yeah,
I go to the side.
Bring it out.
Pull it out.
And to be honest, it's not working. I know they want, but it's like. Yeah, that one is shorter. So you can
No, it is fast on.
Yeah, if it's not, that's fine. Brakes are
You just pull it out.
so you can adjust it over here. I'm sorry.
What time? Right. Because the screws
Wait, before you guys assemble it again, she wants to know if you can fold the chair so that it's easier for transporting.
The two of them not facing the same way.
Yes, let me show you how to do that. Can you hold this for me, please? So if you want to fold it down for transport, all you need to do is go down here to this piston. Here you have a lock ring, so first thing you need to do is to pull the lock. Once you pull the lock, just pull this forward. Yeah, careful because we have the laterals here. If we take them out, you can fold it all the way down.
Let's take them out.
Yeah.
Somebody put that one wrong. Alright, so that will be a little step up. Because this one is the correct way she put it in, and that one put it wrong. So, okay, come on.
Just pull it out. How else you take it out? Is the chair heavy?
Yeah, that's heavy.
Remember, she said like a house.
And it's still light compared to other chairs.
Yeah,
To move that, this is easier to move in a vehicle. It's actually.
So a standard chair. No, standard.
A standard is not this heavy.
A standard chair is usually like 50, 60 pounds. Yeah.
This is not even fully operative. So this is much heavier than
So if you want to bring the
Not
back
yet.
part again, just make sure you hold the piston. You align the piston with the slot. You let it follow gravity. And then just put it in for safety. And there you go. Now you guys can build it back again.
So is this going this way or?
Is that way really, really soft?
No, you have to unscrew.
I think she just pull it up. Pull it up. Just slide it up.
No, I meant to adjust. You have to unscrew and then adjust the angle. Because you could get 2 inches from on both sides. So ideally, when we're prescribing this is less. I think this is a 16 inch. We want something who's 14 inches, so they could grow into the chair. You don't want somebody who's exactly 16 in a 16, because then what's the growth? We can't even do a 13 inch. We can't do a 13 because you get 4 inches. You have to do 4 inches less, and then so you can get 4 years out of this. This chair is around 28 to 29,000 with all the accessories. I'm talking about back support, cushion, everything. Without the back supports, everything, just the frame, it's like 17,000. And then when you add in everything, it's around that. Yes.
Might as well buy.
No, you need these supports. So, but if, let's say, example, they don't need this support. They don't need this support. They need a different back. You can get the different back to adjust your And if you need a different neck, this one comes with this neck, but if you need a different neck, see how that neck is on that one, it's small curve. You can buy a different neck and put it onto the frame. This would have to This one with everything is around 28,000. The zippy iris in comparison is usually around 50 to 60,000. So it's a huge difference per pound, be able to afford. But the difference is that be as big. They don't have a certain amount of growth. So it's a good option for a limited budget. And it's still in a good position.
And I
Not in this, but we do have motorized options. We have some downstairs which we'll show you later. But if you need more specialized motorized options with certain tilts and certain stuff, you'll have to get them measured. And on your assessment, and from the assessment, they're going to recommend.
It's a standard-sized cushion.
No,
Specialized.
it's a cushion. One of their cushions is
feels
just
good if your patient.
right. So
They're buying from Jackson Memorial. It is 100% plus.
yes, it will be. It will be. Those chairs are expensive. So what we're going to do is a question and answer later. Talk about your patients. They're going to and they I can't get prices because every case is different.
Yeah, so we have to have a ballpark.
No, I could give you a idea, but when you give me measurements, then we can quotes. But what you can do is talk about
Things the patient who cannot use stairs. You indicate on it, right?
But
It's
does
our
the-
wheelchair.
yes, they do. Does the patient or have caregivers moving around 24/7, or can they move themselves around with, as I said, breath? or talking. Those are the kind of questions we need to do because then the price will be.
Yeah, because I have a patient who can turn his neck and leave it.
So they have,
But he's super rich, right? So he
right.
cannot.
So
yeah.
they have equipment. I've used it before.
Yeah.
Where I'm breathing and it moves the entire thing. They showed me at my last training session and we used it outside. Yes, correct. So there are options if they can afford it. We have the options.
But this wheelchair, you can put a water options.
Not on this one, but we have others. We have others if we can. So my suggestion is, I think around 2ish, they're gonna have a question and answer for your patients. Ask your questions, and if you want further in depth, my business card is on it. Scan it, and then message me, and then we could probably set up a meeting and talk about your patients one on one with them. She has a patient who's called. And what was the
Has
question?
mobility of head and neck.
Head and neck bone. And do you want a motorized or a manual for them? A motorized.
Yeah, we can schedule like little Q&A after we finish these activities, and we can talk a little bit
No,
more.
he bought already. I just
Oh,
asked
okay,
him, we
already
have a
bought.
few patients.
Oh, he bought a chair already. What chair he bought?
Buy from
But do you know what the type of chair he bought? No, you don't know. Okay, but we have options. We have a lot of options. They're the best to answer your questions.
This is another.
I think we could do a lunch right now.
I think so. Everybody, we're going to break for lunch. So we have an hour break. So just the same area where you got your tea, they would have lunch there for you.
So I want to show you some components.
Oh, they're gonna break for lunch.
Okay, but they have a doubt.
Okay, so we're just a
to
quick.
clarify a doubt. We have several components on HTS. You can choose as the patient trainer. You can choose whatever you want. So if you have the try or don't want it, don't ask for that. Don't ask for trunk support if you don't need it. But these are the reflectors. Let me show you. We have 1, 2, 3 types. This is one with abductor. That is the function. And the other one is just the reflector. And last one is this. And it works like this. It works like this. Those are reflectors. That's it.
Okay. So we're gonna break for lunch now, and we'll see you in an hour. Well, we'll see you in an hour on the thing. Yes.
I don't understand. I think it's no, no. I think it's in process.
Oh. Just say us, we can hear you.
Hello, hello. Can you hear me? Hello. Can you hear me? Hello, hello. Yes.
I mean, I think it's okay.
Nobody there.
There's like 4 people.
Okay.
Everybody is starting now.
Dami. Lo que podemos hacer es poniendo las fundas de estos tal vez.
A ver, ¿dónde está todo?
Aquí. Ujú, ujú. Aquí está. Okay. I don't know, but I feel cold. Don't you? Yeah, right?
Ay,
Okay, so we're gonna talk about standard. So the importance of standing. Sorry about it. Yeah. Clinical benefits and equipment. We don't have in physical the equipment, but I will try to explain you the features of the product. So, but in general, we have a lot of clinical benefits on a standing. I suppose you know, right? It's very important to have this. Why? Standing transforms lives for children and adults with any kind of disabilities. The opportunity to stand wherever right, supine, or prongs brings new opportunity for interactions, not just physiological system, or in general. Of course, that's why we designed the Rifton standard. I will show you in a picture. So why it is important? Promotes, that's the word, bones health. Okay, bones health. So promotes bone health by maintaining or increasing bone mineral density. So why? How the bone eat? How? With who or who helps the bone be healthy? Who? The muscle, right? The muscle provide food, health to the bone, right? So if you have atrophy, yeah, you don't have enough muscle to feed the bone, right? So if you put the patient in a standard, promotes that. And another thing is reduce the spasticity or high tone, stretches muscle, of course, reducing contractures, and improves the range of the motion in each articulation. Okay, you promote the spinal align, right? Promotes better positioning, better posture on the column and the spinal column, and support hip joint development with optional leg abduction. It is very important because in the new standard of Rifton, we have the possibility to do abduction with the legs. Why it is important? Because you have his the acetabulum. Acetabulum, it's okay? So acetabulum, we have the head of the femur here, right? When we born, we don't have that cavity very developed or good, right? It's okay. Sorry, I'm going with that. So you have this. With the movement, you do more cavity. Yeah. So if you don't have that, what happened? This is very poor. We don't have the good cavity, so the femur go out, right? So this is subluxury, and this luxation, subluxation, and luxation, right? So if you don't have that cavity, you will have that, and maybe you will have one leg shorter than the other. So the idea of the abduction is to do that. See it. This is my femur. This is my acetabulum. See it. Okay. So we promote that cavity, that good position, good movement. Obviously, facility eye contact with others, yeah, and stimulate the circulation in all body. We have small receptors on our articulations that communicates to the brain that they are there. So I am here. Remember me. No movement, but I am here. Why? Because we have the possibility to stand. So we have the multi-positioning standard. In multi-positioning standard, it's supine, from supine to prone. We have 2-in-1. If you just want supine, we can configure just supine. But the idea is to have both, because as same with the flex pattern or hyperextension pattern, maybe you have fluctuations, and you need both. In this case, you can have the opportunity to have both options on one equipment. Remember, tool-free, so you can angle the legs as any angle you need, from 0 to 30. Okay, and the other thing that it is very important in that standard is you have maybe patients with contractures in pelvis or contractures on knees, right? How do you put a patient in a standard with that? It's difficult, right? Because you have to put it in a straight position, but it is not possible because the contractors. So we have the option in that standard to angle the knee, angle the pelvis, the hip. You can do it. So it is very, very useful. You don't have that in another product. So we have knee and hip flexion adjustment, as you see. Head and trunk supports. That is the standing in prone position. And you have here supine or prone, as you want it. Just remove with no tools and very easy. You remove that part, the back and the armrest support. You remove it and use it as prone. And all parts, you can turn it in another position and do it as prone equipment. The only size or measurement that we need is the total height. And we have 3 sizes, and you can see here, you show you the overall weight. Depending on that, you choose one or other, but take this information with you because it determine which or how much increase or how much the product will grow with the patient. So these are the components. You can choose anything you want, and all components, because it is very important, all components, for example, you receive a standard multi-positioning, supine and prone, you will receive a lot of components. And sometimes you said like, oh my God, this is for what? For what? Hip, trunk, knees, what? So every component has the sign. They said knee and supine, for example. So if I lose some parts, I say, oh my God, it's the knee and it's your supine position. So I use for that. Here, supine, prone, chest. It set everything. So it's very intuitive. And the The website, written website, is very intuitive. It's very easy to use. So now, as closing our training today, if you have any other question or you have to see another topic, obviously we are open to hear you. But closing this training, I want to give you some clinical cases. Same thing, same groups. Remember your number, remember. So I will give you a case, a clinical case, and the idea is that you as a group determine which product you recommend to that case. Is it okay? Is it clear?
Giselle, before we split, see the clip?
Ah,
Can you
okay.
explain it to
Okay.
my staff because they wanted more clarification
Okay.
on the purpose of it?
So this is a product that we didn't show at first. It was in the back. Yeah. Sorry. There you go. This is also a rehabilitation product in the same line as the paster that's over there, but this can be considered to be a more simple and affordable version of this. Its frame is completely aluminum, and it has a support for the knees over here. So let's say the user has a broken leg or a broken knee, they can support it here and they can do the movement like this. It's very easy to do the walking training because it can support my weight and my knee without an issue, right? Something very interesting about this walker is that it doesn't roll backward. So here in the carpet, it's kind of hard to show, but it doesn't roll backward so that you can only train the movement forward. You can consider it to be like the simpler version of the other pacer gait trainer, but this is very accessible. It's very light. You can see I can pick it up with one hand, and also it's adjustable. For this one, you do need tools, but you can adjust its depth very easily by just unscrewing here and moving the depth forward and backward. And it's also height adjustable. As you can see, this is very, well, it's almost a good size for me, but if I want to bring it up and down, I can also just unscrew on these parts and I can bring it up and down very easily.
What height range is this size recommended for?
The height range.
We have 4 or 5 size, but it is not for adults. It's not for adults. It's for kids and adolescents.
Yeah, this is more for pediatric patients. We
Yeah.
wouldn't recommend it for adults.
Pediatric, as in what age, maybe. Oh, it depends on the size of the size. I was gonna say because this is pretty tall. I mean, we have another. We have another size. This is a medium. Yeah, this is a medium. We can use for adults without considerable height, but depends on the size. But we suppose 18. So the other function of this is when the patient is tired, and
Sit.
then
Yeah, I can push her like this. Yeah, without an issue.
yeah. So the adjustment of the height is here. Very simple. Here.
Sorry. You have here that box, so you can move it. You can reduce or increase the height as you need it.
So you would say this is a more affordable gate trainer.
Yes.
Yeah, it's different. It's more standard. This is a walker. That is a gate trainer. That is the difference. If I have a patient who is very dependent or most independent, just need a little bit of support to walk, this is a good option. If I need to learn how to walk, gate trainer. That's the difference. Here, any questions?
Oh yeah. This one over here is another product of the Rifton line. It is also designed for use in water. This is called the wave chair. This is its basic configuration, but it can also be ordered with the leg extension. And basically the main use for this one will be if the user wants to go to the pool, they can put it next to a pool. It's completely waterproof. It does comes with a chest strap and also arm straps, and you can adjust its reclination angle very easily. You can unstrap it from over here. And if you want, you can take the fabric very easily. So if you need to wash it, it's very easily washable. Can also be used in the shower, in the pool, in the beach. And it's also very lightweight. So both of these products are more designed for, let's say, health and toileting systems.
One purpose. One purpose.
Yeah, one purpose.
And remember, if you need the calf rest, you have to add it at the beginning because we cannot add it later. You have to ask with that.
If you want to change the base and have the base with wheels, you can also order a base with wheels separately, so you can stroll with a patient into the shower or into the pool with more ease. This is a basic product, but it fills that specific need of users that want to enjoy more water-based activities that I suppose here in Trinidad is very common, right? Going to the beach, it's an activity that I guess everyone enjoys. So this gives the users that type of accessibility.
Everybody loves the bath time, right? Why not people with disability? Why not?
Yes.
And the security of the mom, because sometimes the mom says, "Oh my God, it's too dangerous," right? Let's take out the bath with the patient. It's more easy. It's easier.
Así, ya pasó.
Ready? Ready to walk? To work? To walk? Yes. Okay, so group number one. Where is it? Number one, I have the case. So pay attention, please. This is the case. Take notes if you need it.
Oh, a question online was, so a frame with similar material to this chair. Do you have any water wheelchairs? A frame similar to this material as a chair? I think they want a wheelchair that could go into the water.
Yes, we have, but not in this.
Not in this.
Not with this vendor. We have another option. Yeah, we have the amphibious chair, that you can introduce the chair to the beach.
Okay. I'll tell them to email me.
Yeah, we're gonna send you the pictures of the product. So take notes. Do you take notes? Ready? Or take a photo. Yeah. The technology. Okay. Number two. Group number two. Okay. Here's the case. Ready? Ready? Group number three? Okay. Ready? Ready to work?
Get into your groups, everybody.
So you have 10 minutes to determine the product to this patient.
Yeah, but
Yeah.
so that way they have to.
Remember, yeah, just a clue.
Then you'll add that stuff
Later.
Yes.
Can you rerun the slide for 2 by 1, please?
Two.
Very good report.
No,
you're welcome.
No, no, go to your
Yes. Okay, 10 minutes.
That's what I want.
The right. Which chair you want? Which chair you? Which chair? Is it the right one? Yeah. The creatine plus. Creatine plus. Right.
That's the one we put on. We like John wants to know if they could join us just online. I know. Okay. Okay. Who has a mic? Who has a mic? We're gonna give them a group. Stephanie, would you like to mic so people can hear what y'all are talking about? You're finished? Is that one? So just read out the clinical and explain to them what y'all did. This is group number 2? 3. This is group number 3.
They want to hear all brainstorming. Oh. So
For the online, and they want to hear your
I am singing stuff outside. I'm gonna read it out.
Stephanie didn't.
No. Stephanie, read
Go
it
ahead,
out.
Steph.
You have a good voice, Steph? She wants us to read out the clinical thing and then read it.
Clinical case number 3. The patient is Liam. He's 8-year-old. His diagnosis is cerebral palsy. And his goal is moving from assisted stepping to independent walking in the school hallway. The clinical clues is he has a flexor pattern. Liam presents with a strong dominant flexor pattern. He tends to collapse at his hips and his knees, leaning his entire body forward. And he has a forward fall without physical anterior block. He loses a center of mass and risks falling into the frame of the device. He's also winging, uses his arms in a high guard position to compensate for his lack of core stability, and then scissoring. He has high adductor tone, causing his knees to cross the midline. So we're thinking. So we're thinking the dynamic pace and gait trainer from a posterior approach would be the best solution for him.
Okay, that's group number 3. Put your comments in if you have any other suggestions. This is group number 1. Can you read for the online what your clinic is and then what your reasoning for your answer?
Okay, we're clinical case number 1, patient with spasticity and scoliosis. Patient's name is Juana P., 12 years old. Diagnosis, spastic cerebral palsy, quadriplegia. Reason for consultation, he is a big boy now and needs a special equipment for daily use at home and at school with adequate postural support. Relevant history is that he has severe spasticity in the right hemibody, mild scoliosis at the thoracic level, and poor trunk control when sitting. Requires lateral support for prolonged periods and is completely dependent. Mission, define the prescription based on Juana's clinical presentation and history and identify the ideal product he needs and provide a justification. for
So
each
what is the
component.
item you're thinking of right now to
We are
prescribe?
thinking of the Coyote T Plus for with the cushion GS.
Yes, the
Yes,
JGS.
Yes,
Yes.
for the support, for the sitting support, and also the lateral support.
Okay.
So you can for your
trunk.
Okay, perfect. Thank you. Is this group number 2? Is this group number? Can somebody read us the clinical item so the online could hear you all? And then give me just a brief reason what you'll choose after you read it. That's a Iris. What's the clinical? Can somebody read the clinical? Yeah.
From patient information.
Yeah.
Everything. So
No,
patient.
from clinical 2 down.
All right, clinical case number 2, pediatric patient with Duchenne muscular dystrophy. The patient's name is Miguel R., 10 years old. The diagnosis is Duchenne's muscular dystrophy. The reason for consultation, he has significant weakness is present and they wish to continue studying. Relevant history, progressive weakness in the lower limbs, difficulty getting up from the floor, Gower's sign, unstable gait, currently uses a walker for short distances. He maintains good strength in the upper limbs. He can propel a manual wheelchair for short distances. Limitation of prolonged mobility, risk of contractures, and progressive scoliosis. And the objective is to maintain functional independence, prevent deformities, and protect posture.
So what's the idea? What you want to prescribe?
We would prescribe
CPRS. That's CPRS.
a CPRS, which is customized to suit the needs of the patient or the child.
Do they need to be pushed or they?
No, notarized will where you could press and go to where you want.
So this is not motorized.
We need a motorized
They need a
design chair
Correct.
for the needs of the patient, right?
Yes.
Right. Although the child has upper strength, that would help with the hand to maneuver the chair to direct the path because they generally lose all the muscle tone and
Do
everything.
you want a wheelchair that's motorized that also reclines and does tilt in space? Or
Reclining is not necessary. No, reclining is not necessary because if you put him to sit, he would sit, right? But if you put him on the front thing, he flop over. But if you put him up to sit, he will sit independently.
So what about
No, no.
tilt in space?
He has
Tilt in
scoliosis.
space does this.
Okay, he has scoliosis. Well, I didn't get that part right, but we can have a little tilt in it too, right? So we can make comfort. Yeah, the turn in school.
So
This is what I say in the. That's what I said in the motorized chair that will cater to the needs of the child with all of these diagnoses.
So what you need to ask them is what quickie wheelchair. Yes, we'll just need to confirm that, but that will be when the cookie family. Okay. Thank you. He doesn't understand. Even Jack doesn't understand me. He only speaks Ready? Ready? All right, thank you. Nice to meet you. So, Red Anna, are you ready? Who is group number 1? Wait, we have to tell them to go downstairs. You? Okay, so another part of the task now. You're going downstairs in our store in AA Laquis. As a group, you're finding one product that we have and applying it to your case.
You can't just leave the store without you telling us what product it is, though, because we need to note it. So you're gonna present it with your product and your case. So you have 10 minutes. 10 minutes. So follow Nicholas. No, you're using one of our other products downstairs, another product. So you're going downstairs to look at our showroom, see what we have that we could apply to your case. You have 10 minutes. Only in our store. Anything in our store. Pick any item from the store. All right. Online people, we have a little time with you. If you have any questions, you could let us know. Okay. Good job. Woo! Good job. Good job. Listen up. Tomorrow will be good too. Yes. Oh my God, tomorrow they just told me that we have no. She said that we got it. She got somebody from the ministry communications department to be there. They were taking photos and videos tomorrow. Oh! You have to hold the camera. She said they have a lot of people from the government hospital coming, so that's great. And they're really excited and they're getting a lot of questions for items. I want to know what items we should take. We need to. I do this report on the water. This one. Or the queso. This or the queso. I mean, stay here. So take this. I mean, it's up to you.
What do you consider to be better?
Depends on you. Which product you are more interested in. Then coyote. C plus, I think.
Can they
Can you hear?
can they hear? Online people, can you hear? I could just talk very loudly.
Yes, you can hear now.
Right. So we have a 12-year-old boy who has quadriplegia, spastic cerebral palsy, and he is affected more on the right side of his body. He has mild scoliosis, which is the curvature of the spine, and it's at the thoracic level. He has poor trunk control when sitting, and that's going to be important because it says requires lateral support for prolonged periods. And we had to take that into consideration, of course, because he's 12, which means that during school hours, he will have to be sitting for a fair amount of time, especially in our school system. And he's completely dependent, which means that we could not use any of the motorized versions of the wheelchair. We chose the Coyote JPG. Is it JPG? T plus. The other benefit of this one is that it can be adjusted in so many ways, both at the head, the arms, the inside guides as well, because this child needs to have something that he can use in school as well as at home. Anything else?
The item from Era.
So we actually used the hoist because of his dependency and because of also it says he's a big boy. So something that he can use daily and at home so that it could help him, which especially transferring from the wheelchair into the bed and bed back to there.
Very good. Thank you. Who would like to talk to group number 2? You're looking away from me.
Yes, I am.
Okay, group number 2.
Okay, so we have a patient with spasticity and we have a patient with Duchenne's muscular dystrophy. Our patient's name is Miguel R., who's 10 years of age, and he has significant weakness in present and wishes to continue studying. Now, he has progressive weakness in the lower limbs, difficulty getting up from the floor, which is a Gowers sign. He has an unstable gait and currently uses a walker for short distances. He maintains good strength in the upper limbs, can propel a manual wheelchair for short distances, and limitation of prolonged mobility. So he has a risk of contractures and progressive scoliosis. He wants to maintain functional independence, prevent deformities, and protect his posture. Right, so what did we decide? I think
Bring the item. Quick, something. Bring it out.
is Natasha. Because you are the one that called it by name.
I was going to say she wasn't standing.
Where's the walker?
So the walker is the other item we chose from downstairs for AA Laquis. Because this is for the short distances and he doesn't have any problems with his hands. So we imagine he can use the brakes to stop the wheels if he needed to.
And the item you suggest that he uses?
The wheelchair.
Notarized wheelchairs tailored for the needs of the patient, along with the walker for short distances.
Any special features you recommend?
Yes, we need it to tilt as well. So because he'll be using it for prolonged periods.
Right. So Duchenne's unfortunately means that he will lose muscle strength over time. And so the wheelchair is definitely designed for someone who wants to maintain independence, but may lose his strength on a daily basis. It will vary. Yes, the motorized power wheelchair.
Right. So with the wheelchair and customizing, we could basically get support for scoliosis as well. So that's why we chose that one too. Yeah.
Excellent. Woo! Good students. Woo! I am very proud.
Who will be speaking for group number 3? Who's me? I didn't see who me was.
Right. We have group number 3. We have an 8-year-old boy named Liam who has cerebral palsy. His goal is moving from assisted stepping to independent walking in the school hallway. Things for consideration is a flexor pattern. He has a strong dominant flexor pattern at the hips and collapses. He has a forward fall without any physical or anterior block. He's also winging in his shoulders. He has a high guard position to compensate for lack of core stability. And he has scissoring, so high adductor tone, causing his knees to cross the midline. So we chose collectively the dynamic pacer gait trainer. Reason being, we'll use it posteriorly, have him here. Then, yeah, so we put him inside there posteriorly. We want to, the additional stuff that we want is the abductor cushion from between his knees. We wouldn't mind if he had that, what do you call those things that you hold him? The handrail? Hand grips to hold, so just kind of help with his forward tilting and whatnot. Yeah, I think this is a great option. Yeah.
I'm too happy.
Great.
And then we chose the ball to work on his hips to get him in a little bit more extension and to help with core stability and strengthening to help facilitate his goal.
Good students. So, what do you think about the training? Did you like it? Was it useful?
Yes.
So, thanks again to share your knowledge with us because we learn a lot of you. So, thanks for that. I want to say you please continue doing the best every day. You have a lot of responsibilities, so many people trust you. So please continue doing the best. And thanks for your time and good luck to everybody. Thank you.
Before everyone leaves, we like to take a photo of the group, and then you'll get the certificates when you meet the girl. Thank you again, everybody.
Thank you. Ready. Should we take the picture here, right?
We'll take it right around the corner.